Thank you for joining us, and welcome to the Hilton Guam Resort and Spa, where we're waiting for the Guam Medical Association to begin its 2022 Democratic primary debate between Governor Lulian Guerrero and Congressman Michael Sinicolas and their running mates, Lieutenant Governor Josh Tenorio and Sabrina Salas Matsunani. Throughout tonight, you get a special treat, and that's us. We've got this panel of commentators, and boy, can we commentate. You want to take it from here, Ray?
I could run for a couple of seconds here and just say what an incredible experience this is. I think this is the emptiest I've ever seen this ballroom since I've been hosting gigs. And in fact, the last debate that I was a part of, the last gubernatorial debate, was in this room featuring Lulian Guerrero, former Governor Carl T.C. Gutierrez, Frank Huggan Jr., and
Senator Dennis Rodriguez.
Senator Dennis Rodriguez was in the room at the time. And it was absolutely packed. These are definitely the sign of the times that we're dealing with now, Cousin Troy, where we are still kind of COVID curious, as it were, and so it's just us.
Well, I think they're waiting for, or like everybody. There's a lot of people out there waiting to come in. I don't know this room is going to fill up with doctors, but we also have to your left, Ginger Cruz. From the Lou and Josh campaign.
Hey, yeah.
Wow. We haven't. I mean, this goes back to old Guam cable TV days. I don't think it's been 30 years since you and I have shared a microphone for any longer than a few minutes.
Yeah, don't date us, Ray.
That's
it's
okay.
bad enough that we're getting old and gray, right? No, it's wonderful to be here. I really appreciate the opportunity, and thanks to Kandit News for that. And I'm really looking forward to the debate. I'll tell you, there's some things that don't change, and having been away from Guam for 20 years now, that I've been back for about 2 years, you can pick up right where you left off, man. I'm getting flashbacks to 98 right now, because you got a lot of the same people, you've got a lot of the same issues. I mean, frankly, the issues are almost identical, right? I mean, we're looking at all these healthcare issues. Yeah. We're still talking about accreditation. We're still talking about GMH. So I'm really looking forward to it, because maybe I'll be able to bring some perspective of the long vision, right? Not seeing it every single day, but just sort of seeing the big movements and where things have gone. So I'm really excited to be here.
I might want to interview you for a little bit here tonight. Where have you been? What have you been doing? You came back and spent a little bit of time in the villa with you over at the Dusit, and had a great opportunity for you and I to get caught up. And it looked like you were looking at opportunities maybe here on Guam. Yeah. And then when was it? Was it there was a little get together at your place? I guess it was the debate, and you showed up with some stripes for Lou and Josh, and I said, I didn't get the memo. So what is your position now? With either the administration or the Democrat Party?
So it's with the campaign, with the Lou and Josh campaign. I'm the campaign sort of spokesperson advisor. Governor and lieutenant governor don't need a spokesperson. They're perfectly capable of speaking for themselves. So it's more of a communications advisor. But I'm really excited to be on board doing that. So I've been doing that now for a couple of months. Right.
Well, I've seen your name on a couple of press releases.
Exactly, working behind the scenes. But I've been back on Guam really since 2019. I mean, I still have business overseas, but really I've been here a lot. But because of COVID, right, I was like locked in my house in Tamuting for 4 months. So I mean, it's been kind of hard.
It's possible we've seen each other at Payless, and I was wearing a mask and you were wearing a mask, so it just didn't work out. Yeah. I'm going to give Cousin Troy an opportunity to introduce our other guest.
We have our resident expert on politics and election politics for decades now, Dr. Ron McNinch. Welcome, Doc.
Hey, half a day, Ray, half a day, Troy, and certainly a pleasure, Ginger. Absolutely.
Well, when we come back from this commercial break, I have a few questions for Dr. Ron McNinch, and we'll riff from there.
4 years ago, we pledged to make healthcare more accessible, raise nurses' pay, and invest in our healthcare system. We have kept that pledge.
We increased income limits so that more families qualify for Medicaid, and we've made important advancements in telemedicine.
Our community health centers responded to COVID-19 while continuing to provide critical services.
The dedicated teams at our local and private hospitals provided quality, compassionate health care, even in the toughest situations, all while maintaining the highest standards.
Our healthcare partners, like our clinics, have also stepped up to answer the challenges, and we cannot thank them enough.
But if we are to provide the best in health services, we must build a new hospital.
Let's continue to move forward. We are all in this together, and we humbly ask for your vote. This is Governor Lulian Guerrero, and I approve this message.
Funerals actually take a lot more planning than I expected. With us using island cuisine for the first time, of course we were iffy, but once they came and showed us their service, their food, tasted their food and everything, we definitely use them again because their service and food is just awesome.
We are agents of change, shining the light on corruption, land scams, children being raped, growing violence, and the wrecking ball of poverty. While we have grown and been able to expose many of the dark corners of our islands because of the confidence you and our advertisers have placed in us, there still is so much more to do, so much more to clean. Kandit's flame must grow brighter. Fuel this fire. If you want the light shined on corruption in our governments, rape and violence against children and women, land scams and poverty, then advertise with us or sponsor our programming in Guam and the CNMI. Call us at 671-922-NEWS or email us at advertise@candidnews.com. This is the future. Fuel this fire.
Welcome back. So this is our debate pre-show, and we're truly okay. So Kandit, The Point, and the Guam Daily Post. You know, we did a couple debates already, but truly, this is the debate of the season. This is the one that everyone just needs to watch because this is where things potentially get exciting. And in the past, this is where the excitement has been in gubernatorial debates. And so, you know, the candidates tonight can pick up quite a few votes. They can lose quite a few votes depending on how they do. We are waiting now.
Is that why Felix and Tony aren't here?
Well, this is just a primary debate. They don't have a challenger.
You did want color commentary, right? Okay.
And so, we can ask Dr. McNinch about how those dynamics play out. But first, we're waiting for the debate to start. It's supposed to start at 6:30 with a coin toss. We see Dr. Tom Shea up there. I think he's the president of the Guam Medical Association. He's the guy that made this all happen.
I thought he was embargoed from attending. I thought that was the deal we got
COVID
from
negative.
Akimoto.
No, he's COVID negative.
No. I thought the reason why they were suggesting that he was going to sub over at the hospital was so that he wasn't going to be here twitching all night.
Oh, got it. Thanks.
That's what they said.
You're in for colorful commentary tonight from this panel. Mm-hmm. So I want to ask Dr. McNinch, are there parallels? Ginger brought this up. She brought up 1998. And I'm just wondering, are there parallels in this primary election to previous elections, or is this and I think this is why Mike Nicholas used the unicorn. Is he a political unicorn in this? Is the incumbency going to be a very strong factor as it's been before? What's happening in this election?
Well, in past elections, in 2010, I think that former Lieutenant Governor Mike Cruz lost the election at the primary GMA debate.
That's when he was challenging Senator Eddie Calvo at the time.
Right, that's correct. And he made a major misstep. He alienated the older Republican voters that were his really core base, and that allowed Calvo then to pull well ahead of him, and it never went back. And so you'll see these kinds of, I call them cascade events, and so this debate sets up a potential for a cascade if it happens. And we saw a similar cascade in 1998 related to negative advertising directed toward Governor Carl Gutierrez, the Isla La Puta advertisement and things like that. We have plenty of good examples in Guam politics of how the wrong move at just the wrong time can really have an effect, and these events are important, and that's what politics and that's what democracy is all about. It's a rough and tumble business. It's not easy. If it were easy, everybody would do it.
Don't disagree. I don't disagree. I think, and though there are times where just out of the blue, there might be a stimulus that will change everybody's minds. And we don't have to go too far back in time to think about what was happening on about the 3rd or 4th of July just down the street over at Pleasure Island.
In 2018.
What was started as a block party but turned into the Glock party, and where some people were they're absolutely positive, absolutely sure. Some of the research was even pulling very, very hard for Ray Tenorio to continue a Republican regime over at Adelute.
He was supposed to win that election.
He was supposed to win the election.
That block party was an anomaly.
Yeah, it certainly was. But then I want to say that the overreactions and the reactions after that only cast further doubt in the minds of all of the voters. And about the same time, many of the people in this room, I thought, did a very, very astute job. Francis Santos was just standing in front of us a little bit ago, but folks like him, Tom Atta, and some of the other handlers for Lulian Guerrero said there's a definite opening. Start talking like a conservative, because the Republicans no longer have a guy in the fight. So start sounding like a conservative. And she did at this very stage start doing that, and I think changed a whole lot of minds. And people that were resigned to the one choice that they had in the Republican Party all of a sudden decided Lou doesn't sound so bad.
Well, there's a couple other things that are factoring in too, and there's sort of like these big issues that are intruding on Guam's politics, and one of them is abortion, right?
You think that's a big topic?
Absolutely. Like who, and being the only woman on the panel, I'll tell you, like who 20 years ago would have ever thought that Roe v. Wade would have been overturned? I mean, nobody ever thought that was going to happen. Everybody had political positions, but they were just political positions. And now you're talking about women in the privacy of their own home, thinking about who they're going to vote for, seriously facing this change, this shift, which is going to take away people's opportunity to choose, which is going to, in some cases, force a woman to have a baby, which, just watch The Handmaid's Tale, right? I mean, you can tell where I come down on the issue, but I mean, the reason that became such a popular show for women is because deep down inside you kind of take it for granted that you can do something, right? Marijuana is becoming legal. All these things are becoming possible.
Same-sex civil unions, yeah.
And then for the group of women who believes firmly that we always should have the right to choose, it becomes a real issue. And I think it's things like that, some of these major movements, that might make a real difference in the local elections, because we all know that Governor Leon Guerrero has always been pro-choice. I mean, that's been a strong part of her base, and we know where the Republicans stand on this issue. And I think these things are going to.
But to what degree is she going to be able to be very, very influential there as the governor? I mean, where it seems to me the battle is going to be on what happens with the choice question on Guam. That's at the legislature. I think that's at the legislature. Leaving Camacho was a 10-foot pole to get this away from me, and did absolutely the opposite of what he should have done. As a
Governor has veto
move.
power. Governor has veto power.
Dr. McNinch, I'm curious.
So far, there are no measures, though. Nothing has left the legislature, so I see the stage being set. But we've got 29 days from today between now and the primary election, and incidentally, the primary election started this morning at the Westin.
It did.
Get out there and vote, people. Vote early. Dr. McNinch, I want to go back to this 1998 issue, because in 1998 there was an incumbent governor, Carl Gutierrez, running for re-election, and he faced a battle from two Democratic teams.
No, even more. He faced 95% of the voting electorate with all the crossover Republicans, because only 5% of people voted Republican in that
for
election.
Joe Atta in the primary election in 98.
And it caused chaos within the Democrats. It was very unfair, to be frank, to the Democrat candidates, all the Democrat candidates, because of the crossovers.
Okay, so about 5 minutes, we'll have everybody see.
So what's going to happen in this election?
I think the same thing.
Okay, so there are parallels then.
Oh yeah. I think they're going to be, and we can easily measure it. The basal number for Republicans is 42%. Mm-hmm. So if we look at any, in 2018, 20% of people, when Ray was standing alone, 20% of people voted Republican in the primary. 80% voted in the Democrat side. I think we're going to see very similar replicative numbers in this race.
Mm-hmm. When we come back from a commercial break, I want to ask Dr. McNinch and our panel what they perceive to be are the greatest weaknesses that Governor Lulian Guerrero and Congressman Michael Nicholas are struggling with as they head into the primary election when we come back from this commercial break.
4 years ago, we pledged to make healthcare more accessible, raise nurses' pay, and invest in our healthcare system. We have kept that pledge.
We increased income limits so that more families qualify for Medicaid, and we've made important advancements in telemedicine.
Our community health centers responded to COVID-19 while continuing to provide critical services.
The dedicated teams at our local and private hospitals provided quality, compassionate health care, even in the toughest situations, all while maintaining the highest standards.
Our healthcare partners, like our clinics, have also stepped up to answer the challenges, and we cannot thank them enough.
But if we are to provide the best in health services, we must build a new hospital.
Let's continue to move forward. We are all in this together, and we humbly ask for your vote. This is Governor Leon Guerrero, and I approve this message.
Funerals actually take a lot more planning than I expected. With us using island cuisine for the first time, of course we were iffy, but once they came and showed us their service, their food, tasted their food and everything, we definitely used them again because their service and food is just awesome.
We are agents of change, shining the light on corruption, land scams, children being raped, growing violence, and the wrecking ball of poverty. While we have grown and been able to expose many of the dark corners of our islands because of the confidence you and our advertisers have placed in us, there still is so much more to do, so much more to clean. Kandit's flame must grow brighter. Fuel this fire. If you want the light shined on corruption in our governments, rape and violence against children and women, land scams and poverty, then advertise with us or sponsor our programming in Guam and the CNMI. Call us at 671-922-NEWS or email us at advertise@candidnews.com. This is the future. Fuel this fire.
Filling up, we have we see Congressman Michael Nicholas is here with his running mate Sabrina Salas Matinani. I see their families here. I don't see Governor Leon Guerrero yet, but
I saw Josh walk in.
Lieutenant Governor Josh Tenorio is
Yes.
here. Okay. More doctors are coming in. Some people from each of the campaigns are here, and the debate will get underway at 6:30 with a coin toss. Before we get to that, so we know what the strengths are of these candidates politically. Congressman Michael Nicholas is probably the most popular politician we've seen in quite some time. Governor Leon Guerrero has the power of the incumbency, and she seems to have a whole lot of resources behind her. She's got a great advertising campaign that, I mean, everywhere you go, there's the presence of the Lou and Josh campaign. So this seems to be a real big fight. But what I want to know, we'll start with Dr. McNinch, and we'll make our way down this panel. Doc, what are their biggest weaknesses? What are the things that, if you were to advise the Lou and Josh campaign and the Mike and Bree campaign, you got to shore this up, what would those things be?
Okay, on the positives for Mike, he's had the advantage during COVID to be in D.C. rather than here. And so in a way, he's been able to really frame his image very, very clearly with everyone because that's where his role was. His role was in D.C. The governor, on the other hand, had a lot of heavy-duty burdens here, and there's a split between how people view her approach to things like COVID. And, of course, COVID is the girl in the room for this election. That is, it's the litmus test for how people judge these candidates. So Mike gets a bit of a pass on COVID, and the governor gets the heavy green light, red light on it. And so that's a little bit of it. The other thing is, of course, there are the issues with the investigation, the ethics investigation that Mike is having to deal with on the D.C. side, and then how that's articulated in the local process, whether is this just fluff from some committee in D.C. or is it something that really needs to be worried about? and the public all have to make up their minds over this. And so we have like several balls in the air that are being juggled at the same time.
All right, yeah. So I think the biggest challenge that the governor and lieutenant governor, the incumbents, have right now is you're dealing with a lot of pressures on Guam that were not created on Guam, right? COVID just, it hit the entire world.
That
and they've
people
had
are going to assign to the governor.
Exactly.
Okay.
So she's going to have to deal with the pressure of all of these economic problems. The CDC is the one that initially ordered everybody to shut down in the world, and with mask mandates and everything else. So a lot of that, she's going to have to take the brunt of that and demonstrate to everybody all of the things that she's done to keep Guam sort of even keel. And it's, frankly, from the outside, it's been amazing that Guam didn't suffer more. You would have thought, with tourism being the mainstay of the economy, that COVID would have completely decimated the island. And instead, they've been able to really keep a steady keel and keep it going. But she's going to have to make her case to show people all of the things that she did in the midst of this. Absolutely. And then you've got, the Ukraine war, right? So she's getting blamed for gas prices when we're talking about the world inflation, world gas prices. So that's her problem. I think the biggest challenge, of course, for Mike Nicholas and for Sabrina Salas-Matanani, is the ethics complaint out of Congress. That was a very critical report. It was written by a very credible enterprise, which is the Ethics Committee of the U.S. Congress, and a referral to the Department of Justice is very serious. I'm a former Deputy Inspector General, and we referred 62 people to the Department of Justice for crimes that were committed throughout, the Iraq Reconstruction program, and a lot of those ended up in convictions. So that is very serious. It's a cloud that hangs over him. And I think the other challenge that he has is really demonstrating experience on the administrative side of things. Because when you look at Lou and Josh, they've been in business. She's been a nurse. They've done administration. When you look at Sabrina and Mike Nicholas, Mike has been a politician his whole life, and Sabrina spent 25 years on KUAM. And so, is that a team that really has the experience to handle a $2 billion economy and all the challenges that are going to hit us in Guam? So I think there's a lot that we're going to see tonight, and we'll see how they respond, and we'll be able to analyze how they sort of explain their strengths and their weaknesses and see what they say.
First of all, you are supremely talented. Tom Shea is talking behind you, and you can still keep your thoughts in your head. I'm going to echo some sentiments that you were talking about. Lulian Guerrero and Josh Tenorio have to defend everything that they did. And as you point out, some external factors that are at play here. But they're at play virtually everywhere else across the country. Many incumbents are having to make the same argument. I think the biggest problem that is facing Mike Nicholas right now is I don't think they told him that the primary is a ground game. And I tell you what, I'm not seeing him on the air as much as he should be. I don't see him getting interviewed as much as he should be. I don't know that these guys are as visible as Lou and Josh in the All In campaign, and they very, very early on started out with big stage side signs and appearances and rallies and things like that. And I think the machine of Mike and Sabrina have to get to work on something like that. I think in my mind it will come down to something as simple as, do people know who you are? Do they even know you're running at this point? In the meantime, Cousin Troy, what about you?
I want to talk about that. I want to go back to this idea of Mike Nicholas is a political unicorn. Doc, is this the election where we see that ground game isn't as
after the coin toss
critical as it has been before? Because I agree, ground games, they've been critical throughout elections in the past, but we've also seen Mike Nicholas creep up on people without a ground game. He beat Natalie Berdalian, he beat Robert Underwood. He had no ground game whatsoever. He hardly had any advertising either. Are we going to see that same kind of thing in this primary election, or does he need that ground game? Does he need that visibility?
I think the gorilla in the room for the primary is the number of crossover votes that are going to happen. And so what happens is we allow this permissive system to happen where anyone can jump in and vote for anybody on the ballot they want as long as they stay in one column. And that's going to be the dominant point in this election, in my view, is where are the crossovers going to fall? And so if we're talking ground game, is Mike going to benefit from them, or is Lou going to benefit from them? Because we know there's going to be crossovers interfering with this race.
So if we were on
he has a very, very good reputation among Republicans, and it doesn't surprise me to see Mike Nicholas at events that I think are exclusively Republican.
Rosario for AMC.
Should we be turning it over to the GMA, or do we continue our
be
comments,
able
or what's
to
going
escort
on?
people out,
I think they're
and they
still
will help
talking
clarify
about the process.
any
And
question that
while
may
they're talking about the
have
process, I just wanted to throw one more thing
regarding
in.
medical terminology,
There is the question
but I don't
of the
think
Peter
that's
principle,
necessary.
right?
Okay.
So there are people who do fantastic at one
without
level,
further ado,
like for
I
one
wanna
office.
go
Everybody
ahead and
loves them. They're a top
both
vote
candidates,
getter.
and we know
And
them
then when
very
they go
well.
after
I
a
wanna
different
welcome to the
position,
stage
all of a sudden
the
there's
team
a whole
of
different
the
metric
current
that's
governor,
used.
So like Tom
Governor.
Adler.
Exactly.
Frank
Exactly. I mean, you can name people throughout Guam. You can name people on the national side. So that's another thing I think that we need to look at is somebody who was very popular in other, slates. When they're going for the position of governor, are they going to continue to have that pull? So that's something to look for.
We'll see it soon enough. Now we turn our attention to the debate. I think we're going to have
And
the
let's
coin toss.
welcome our other candidate team, the team of Michael and Sabrina, Congressman Michael St. Nicholas and Sabrina Maldonado. Okay, let's go ahead and have a seat. Can we have the next fun part? This is the fun part. It's a coin toss. Because we don't know, Oh, I forgot to introduce the timekeeper. Timekeeper, Dr. Billing, and Erica Alfred. There you go. Now, we're not going to be like super strict, okay, 30 seconds, quiet, done, boom. We let you finish your sentence, okay? Just to be as courteous as we can to the candidates. Coin toss. Governor and Congresswoman, you want to come to the stage here? Hi. You want to do the honors with me?
Are you living in Pakistan? Coin toss.
Yes. Kai is a football player, so he specially requested we use that silver ballot. Governor, what would you call it, heads or tails? Okay, heads or tails. Kai, get up. Go ahead, announce that.
It is tails, so Congressman.
It is tails, so you can either receive or you can punt. It's football game. It's football season. So you can punt or you receive first question.
I'll do first one.
Okay, thank you. Okay, make sure you silence your phones and let's have a great debate. Oh, and candidates, you can take off your mask. You're okay.
Thank you very much. So the first segment will feature the two gubernatorial candidates. So Governor Leon Guerrero and Congressman St. Nicholas, would you please make your way to the podiums? Okay. So for the first question for Governor Leon Guerrero is in regards to the hospital. So as we all agree, Guam Memorial Hospital is structurally unsound, illustrated by the recent demolition of the Z-Wing. A new public hospital would be a very timely addition to the healthcare system of our island. What factors are most important for consideration in identifying the location of a new hospital? Your 2 minutes will begin now.
Thank you very much. Of course, a new hospital is very much needed. The Army Corps of Engineers has said to us that the life of our current hospital is only 5 years. So it's very urgent that we then build a new hospital. The factors that have gone into the location is first, space, acreage, and in a central location. We now have a hospital in the west side of the island. We would like to have a hospital in the east side of the island, and that is more accessible to the south, the central, and of course, there is already a hospital in the northern side. Additional to that is a space that would then be able to house not just the new hospital, but also public health, behavioral health, a veterans clinic, and of course, public health, and a new public health laboratory. Also factored in there is the topography. Factored there is the infrastructure accessibility. Factored in there is the traffic. So these are all the elements that have gone into assessing and deciding and locating where a new hospital should be built.
Thank you very much, Governor. Congressman St. Nicholas, your 1 minute rebuttal will begin now.
Could you repeat the question real quick?
Yes. So, as we all agree, GMH is structurally unsound, illustrated by a recent demolition of the Z-Wing. A new public hospital would be a timely addition to our island's healthcare system. What factors are most important for consideration in identifying the location of a new hospital?
If we were constructing a new hospital without an existing facility or without an existing system of care, then we could be a lot more flexible in where we want to place it and factor in other considerations like geography or proximity to certain demographics in our community. But at this juncture, we really need to place a hospital in consideration of the fact that it has to be a functional facility. And when I say functional, that means that it actually needs to work with our existing system of healthcare. In communication with our doctors, it's become clear that there are many concerns about placing the hospital in the current proposed location down at Eagle Field because of the proximity issues in the existing system of care. The doctors want to be able to get to a hospital faster because their existing operations, for the most part, are more along the Tamuning central part of the island, north central. And so we already have an existing plot of land that's been identified. There's a generous family that donated it to us years ago at Oka Point. And so if we can stay focused on the fact that we have to have a functional facility that works with our existing system of care, I think the best place for a hospital is up in Oka Point.
Governor Leon Guerrero, you will have 30 seconds for your response.
Actually, my main priority in the location of this hospital is of our patients. And the priority is our citizens and the accessibility for our citizens. That's the priority. There is a system of healthcare delivery in the central of our island. There is certainly a Dr. Wynn's clinic, which is only 2 minutes away from the new hospital. So my priority primarily is providing more the convenience, the access of our people of Guam.
Thank you very much, Governor. So we'll move on to the next question. This next question is also in regards to the hospital, and it will be for Congressman St. Nicholas. While a new hospital has been estimated to take 4 to 7 years to be constructed, Guam Memorial Hospital remains the only public hospital, as well as the only inpatient care facility with an active labor and delivery ward. What improvements would you make to GMH in the meantime for Guam's women and children?
I just want to do a quick shout out to my kids. This is their first time seeing Daddy live. My family came in, so I just wanted to say hi. I love you guys so much. GMH is going to have a useful life for another 7 years maximum, maybe a little bit more if the new hospital is going to take longer than we'd anticipate. And so we need to make sure that we continue to invest in the existing GMH so that it's going to be able to provide the same standard of care that our people are going to be needing over that 7-year period. From an investment standpoint, it will be wise for us to make sure that we marry any assets that we're going to continue to pump into the GMH facility with the useful life of that particular investment, and then the return on investment, not just in terms of patient quality of care, but in terms of whether or not it's going to help us generate revenue, because the hospital has always had a revenue problem. Dr. Shea has been an advocate for many years about renovating the labor and delivery ward. That's a common sense investment. It is a profit center for the hospital. And then if we make those investments early on with the resources we already have, we can extend the benefit of the renovated labor and delivery ward and get the maximum value out of that 7-year investment. We're gonna need GMH for 7 more years. So let's make sure we pump resources in where it's going to make sense. Definitely renovating labor and delivery is one of them. And then we should also have conversations about the future of GMH. Are we really going to just move out from that facility and then it turns into just another skeletal GovGuam building? Or are we going to find new ways to repurpose it for adding additional services for healthcare? You know, if we're going to invest, for example, in a labor and delivery ward, perhaps we should consider also converting it into a children's hospital or a senior citizens hospital, or a combination of both, so that our young and our old are interacting. There's so many different possibilities that we can make, that we can explore with GMH. But the reality that we have a 7-year timeline that needs to be dealt with is something that we're going to have to face, and we have to make the right investments to maximize that useful life.
Thank you very much, Congressman. Governor, you have your 1-minute response or rebuttal.
Yes, the reality is it is only 5 years of life. And we are pumping in money to make GMH more safe, to make GMH more operable. We are putting money into helping fix the roof and a wraparound to make sure that leaks don't happen when it is raining. We are putting money in to make sure that the electricity is safe and it's relocated to a safer place. Labor and delivery, yes, is a generating revenue service. And expanding or renovating or improving it certainly could be done. But we need to make sure that whatever investment we do, we don't make it so that we are not being able, so we won't be able to shift those resources more to building a new hospital.
Thank you very much, Governor. Congressman, you have your 30-second response.
I would always like to be optimistic when it comes to timelines, but one of the things that I've come to realize in my service in the government is that when it comes to GovGuam projects, the most optimistic timelines are certainly the least likely to turn out. And so pursuing a new hospital, and I'm hoping we get more into that conversation in the future, definitely is something that needs to be done, but the timeline on that is something that we need to be realistic with. The realism in terms of how quickly we're going to be able to get it built, and how long we're going to have to depend on GMH. And if it's going to be 5 years, I hope so, but I really think 7 years, 10 years is a lot better to plan around for realistic purposes.
Thank you very much, Congressman. The next question will be in regards to, again, the hospital, and particularly the hospital funding. And this one will be for Governor Leon Guerrero. So Governor Leon Guerrero, GMH, like other healthcare agencies on Guam, has been fortunate to benefit from the emergency federal funding that was made available to combat the pandemic. But as the world moves on from COVID, these emergency funds will be taken away. Do you believe that it is time to create a dedicated funding source for GMH? Why and how?
Certainly this pandemic has pumped in a lot of money into our healthcare. And GMH has been a recipient of a lot of those. GMH does have a dedicated source of funding, and that is the pharmaceutical fund. Additionally, our administration has pumped over $30 million to GMH for nurses, for traveling nurses, to provide the services and the care to our people, especially during this pandemic. The government is not going to abandon GMH. The government is going to support GMH. And if we have to increase the funding source to GMH so that it can operate, we will. That is our commitment, and that is our pledge and promise to our people of Guam. Additionally, if we expanded our Medicaid, which we have, and shifted uninsured patients into Medicaid, it would decrease the burden of expenses to GMH when these underserved and underinsured people come to GMH for their care, which is the most expensive way of accessing care, through the emergency room. So if we can work to shift those people into Medicaid, decrease the financial burden of GMH, and also they are contracted with a organization that helps them improve their processes of collection. And just over the last 3 months, they have improved in their collections. So if we improve collections, we decrease financial burden, maybe the need for those kinds of revenues would not be there.
Thank you very much, Governor. Congressman, you'll have your 1-minute rebuttal.
The dedicated funding source for healthcare is a really sad story in the history of our government. One of the main revenue streams for that is the collection of tobacco taxes, and that has been just so woefully it has not been done. I've been fighting for that for years, fought for it as a senator, introduced things as a congressman, but really administratively, we need to be collecting on those tobacco taxes, because not only is it supposed to serve as a disincentive for a very deadly habit, but it's supposed to provide that funding for healthcare. And as long as we don't collect on those taxes, we're not going to have the revenue we need. Additionally, we did correct the Medicaid imbalances in terms of the federal government's matching. And I think that resulted in about a $21 million improvement in the general fund. Unfortunately, we didn't take that $21 million and reinvest it into healthcare. We're taking that $21 million and putting it elsewhere. We need to keep healthcare dollars in the healthcare system. When we improve our Medicaid collection rates, our Medicaid reimbursement rates, those dollars should be going back into the hospital and healthcare system.
Thank you, Congressman. Governor, you may have your 30-second response.
You know, the congressman is totally wrong. The congressman's research is weak. The source of this funding is not from tobacco. The source of this funding is from gross receipt taxes. 6% of that goes to GMH. So if he would do his research a lot more accurately, he would not be misleading our people. So the funding source is not weak. The funding source is very strong. Our BPT is strong. Our economy is strong. Our finances are stable.
Thank you, Governor. The next question will be in regards to healthcare access, and this is going to be for Congressman San Nicolas. So, Congressman, with the economic hardships of COVID-19 pandemic causing many to turn to public programs for healthcare coverage, public health has become more overwhelmed with this increase of Medicaid and MIP patients, making it too difficult for many to feasibly get the care that they need. What is your plan to improve access to care? And your 2 minutes will begin now.
Could you repeat the question, Kai?
Yes.
I'm having. Go ahead.
So, as more citizens become reliant on public programs for their health care, public health and other facilities that would accept this coverage become overwhelmed as this volume increases. Does your administration have any plans for alleviating some of the burden that is now falling on these public services in terms of health care?
So just to clarify, your question is because we have more Medicaid funding, it's creating more demand in the system, and how are we going to alleviate that demand?
Yes,
is that your question?
Yeah.
Well, I mean, I guess that's a double-edged sword, right? When you have more resources, you're able to provide more health care. Bottom line is that when you have Medicaid dollars coming into the system, and those Medicaid dollars are supposed to be going to be paying for treatments, the dollars should be matching up to the cost to provide the service. If they're not, then that's a conversation we all need to sit down and have, because then we need to work together to update the Medicaid state plan, which is, by the way, something we really need to do. I remember pulling up the Medicaid state plan on Guam, and I think it's still on the typewriter format. It's been that long since we've updated it. And updating the Medicaid state plan will go a long way towards making sure that the dollars for the treatments are matching up to the cost for the services provided. On top of that, the quality of care will be updated by updating the Medicaid state plan. When speaking with some of our doctors, there was concern about, for example, Medicaid covering insulin. Because right now, insulin covered under Medicaid, you have to get the little vial and get the little syringe, and that's the only type of insulin that will be covered by Medicaid. If we update our Medicaid state plan, we can cover insulin the same way they do it in California with Medicaid. It's the pen injection thingy that's going to be a lot more efficient for the patients. It doesn't have temperature control requirements that make the efficacy of the vial medicine a lot more questionable. So there's so many ways that we can improve the cost challenges in terms of delivering on the service, the quality of service, and the quality of the healthcare that we're able to provide. We just got to make sure the Medicaid dollars are adequate to fund for the services being rendered. I mean, I'm actually disturbed to hear that there may be an imbalance there, because the whole purpose of us having Medicaid for our indigent community is to have those federal dollars and those local dollars being able to pay for the cost of care. Because otherwise, we're going to continue to have to subsidize that with tax dollars, or clinics are going to keep eating it on the back end on their losses.
Thank you, Congressman. Governor, you'll have your 1 minute, and if you need me to repeat the question,
Sure.
I can.
No. Access to Medicaid is very convenient. We just increased Medicaid from $18 million to $133 million. We just expanded Medicaid enrollment and eligibility And yes, we did it by revising our state plan. We revised our state plan, sent it off to HHS, and they approved it. So I don't know what typewriter the congressman is talking about, because it's digitalized and up in the website. We just currently also expanded and provided COFA citizens Medicaid. So this increase in volume of enrollment to Medicaid is really a good thing, because that means more people are getting insured. That means more people have access to health care. And that's what we are all about, providing that access.
Thank you very much, Governor. Congressman, you'll have your 30-second response.
I think the question was focused on making sure that providing Medicaid was going to still be affordable, or something that was going to be sensible from a cost basis for the amount of money that Medicaid is funding. But yes, I mean, we did a lot of congressional work to make sure we got those matching rates increased, and we did a lot of congressional work to make sure COFA Medicaid became a reality. Since 1995, we haven't had that. So it's a really good thing that there's a lot more Medicaid access, but I think the question is, are we really making sure that the dollars coming into Medicaid are adequate to provide the services? And that's something we really need to make sure we're doing properly.
Thank you, Congressman. The next question is in regards to the nursing shortage, and this one will be for Governor Leon Guerrero.
Yes.
So, Governor, with the chronic shortage of nursing staff on the island, what is your administration's plan to alleviate this shortage?
We have plans to alleviate shortage, not just plans, but we've acted on them. We've increased nursing salaries, pay increase, because we saw that nurses were leaving for better compensation. We also work very closely with the University of Guam. We've given them resources and financial aid to expand their nursing capabilities, their nursing school capabilities. We work very closely with GCC, because GCC also provides nursing students and nursing workers for our hospital. And we also have been working with legislation where we passed a legislation that allowed for a network of reciprocity among the Western Coast individuals, so that nurses then now can move from one state to the other freely without having to go through licensing processes. Nurses are very important to our island. Nurses, as you know, as doctors, are the backbone of the care of the hospital. So we have to do everything we possibly can, and we are, to provide then the gap and to close the gap of those shortages.
Thank you, Governor. Congressman St. Nicholas, you'll have your 1-minute rebuttal.
Thank you. You know, the nursing shortage issue has been with us perennially, and it's not getting any better. We're kind of kiting the situation of the traveling nurses, but once that dries up, we're going to be right back to square one. The interesting thing, you know, as we went through the years of all of these healthcare issues, whenever you see the news saying that there's a shortage of beds, it doesn't necessarily mean there's a lack of an actual physical bed. You know, our healthcare professionals educated me on this. It means that there may be a bed, but there's still a lack of a professional able to service that bed. And so technically that bed is taken out of commission. So when we see all these stories in the past of a lack of beds, it's because we either had facility issues or staffing issues. And to address those issues, we absolutely need to be making the investments into building up the available nursing workforce. The medical professionals I've spoken with have been sharing with me that the investments that have been made thus far are not adequate. And this administration has had emergency powers to be able to do those things. They've had enormous amounts of funding to be able to do those things. And for us to be having a conversation now where that isn't resolved is very, very disheartening.
Thank you, Congressman.
Yes. I've been in nursing now for more than 30 years. And more than 30 years. I won't say, because then you'll know how old I am. But I've been in nursing, and this isn't an issue that we are just addressing today. I have worked with the nursing profession to provide certification from University of Guam to certify that their curriculum is up to par. So to say that this is just, we're doing it now, is furthest from the truth.
Congressman St. Nicholas, you can have your 30-second response. Oh, apologies. Sorry, Governor. Oh, next question.
Yeah.
Apologies, everyone. It's very elaborate response there. So the next question will be in regards to the physicians shortage. Guam's healthcare system is in crisis. While we have always been lacking needed specialists, we are also expecting several primary care physicians to retire in the next 5 to 10 years. What is your administration's plan to recruit physicians to come to Guam?
The issue of physicians is just so complicated, and specialists is even more so. You know, when we bring in a specialist, right, and we're like, oh, we really, really need this specialty here, we bring in one specialist to be able to fill that void, what happens is the need is so great that the work becomes so demanding that that one specialist gets overwhelmed, and all of a sudden, you know, they fulfill their contract and they get out of here because it's just overwhelming them. Same thing's happening to our physicians, those of you who have been serving our community for a very, very long time. A lot of you, you think about the future. You think about, spending more time with your families, going into retirement. But because you're just such dedicated public servants, you're all putting that off because you know that if you go away, that same problem that we have with specialists is going to spill right into your particular fields. So we need to do more when it comes to recruiting, and we need to be smart about it. We can't just say we're going to go out there and recruit one specialist. We need to work with our clinics and find ways where we can help incentivize them to be able to go out and find these specialists and have us offset the cost of doing so. One of the examples that we can follow for that is helping them by subsidizing H1 recruitment, if that's something that we need to be pursuing. Subsidize the H1 recruitment, push manpower development funds into that subsidy so that we reduce the risk of them having to go out there and front that licensure cost and bring in these specialists, but not just one. Let's bring in a handful so the workload gets spread out so they don't all of a sudden bail because the job is just too much for them to bear. If we plan things out properly, we acknowledge the problem, we work with our private sector and our clinics, and we subsidize where subsidies are needed, we can resolve this. But it's going to take us having a holistic approach, being very realistic with the problem, and having very realistic solutions to address it.
Thank you, Congressman. Governor, you may have your 1-minute rebuttal.
Thank you. Yes, physician shortage is a concern. I understand we have 452 physicians here, but we need more. And we have to really identify which specialties that are short. And if we do identify those, we can work with other hospitals to partner and have an agreement to send over their specialists on a rotating basis. We do that now with cardiology. We can do that with gastroenterology. We can do that with endocrinology. We can do that with dermatology. That's the kind of actions and plans. We also are working with recruiters, and I know that Lillian is recruiting aggressively through their global network of physicians. We also have to make sure that the processing of licensing is efficient and effective and quick, so we don't lose those opportunities of potential physicians coming to Guam.
Thank you very much, Governor. Congressman, you'll have your 30-second response.
No, I agree with the sentiments of the governor as well. I think it's important for everybody to be on board with this issue because this is certainly not a political issue. This is a healthcare issue. And one of the things we also need to look at are the existing resources we're deploying. I know that the ProTech scholarship, I believe, that allows you to go out and get your medical degree, it doesn't actually allow you to further tap into that resource to go into specialization. When we have these resources that are out there, we shouldn't be having these roadblocks that are holding us back from actually getting to the solution that we're looking for. So we need to work together to solve those things.
Thank you, Congressman. The next question is in regards to healthcare provider shortage in general. So, Governor, may you elaborate on the short-term and long-term goals to support and retain Guam's current nurses and physicians? 2 minutes will begin now.
Can you repeat that again?
Yes, ma'am. So,
when you say healthcare provider, I think about radiologists, pharmacists, laboratory people, technicians. Is that what you're referring to?
Yes, ma'am.
Okay. So one of the things I think is we need to really expand more our opportunities with the Guam Community College and the University of Guam and stand up an educational program that will train radiology technicians, that will train medical laboratory technicians, that will train nursing assistants, that will train other healthcare providers like your respiratory technologists. And so we can use our current mechanism of higher education to make that happen. We can also use GCC so that we can push out quickly more our LPNs. We can use GCC so we can push out quickly our certified nurses assistants. We also have private organizations that do train. We have Faye Avalos' business that trains medical assistants, laboratory technicians. So we have the resources within our own environment to beef up those educational programs so that we can provide the necessary healthcare providers here and not necessarily having to go off island to recruit them.
Thank you, Governor. Congressman, you'll have your 1-minute rebuttal.
If I could just clarify the question, are you asking how do we go about retaining the professionals when they come?
Retaining and supporting the professionals as they come, and the ones that are currently here, that are generated and recruited to the island, how do we keep them here on the island?
So the question is focused on retention?
Yes, sir.
Well, I mean, when it comes to educating our future crop of healthcare professionals, one of the really good examples we've seen when it comes to retention was in the Yamashita Educator Corps Scholarship in Education, where there is a service requirement after being able to go out and get your degree and then you come back and you put in your years of service. So having those kind of tie-ins where we're marrying the resources we're deploying to build up the workforce with the requirements in order to comply to receive those kind of supports. I think those are policy issues that we really need to be focusing resources into. The more kind of scholarships like that we can push out, the more professionals are going to be able to stand up for the industry, and then the more we're going to be able to actually retain, at least for that service payback period, because then they're going to be able to commit so many years to our people and then finally make career decisions after that. Right now, the real challenge is there's shortages everywhere. Our professionals that are staying because they love Guam. They're staying because they love our people. They're certainly not staying for money, and they're certainly not staying because, things are less expensive here. It's the opposite.
Thank you, Congressman. Governor, you'll have your 30-second response.
In any kind of organization and human resource management, in order for them to be retained, you look at why they are not staying. They're not staying because of salary, and they're not staying because of the working environment. So definitely, when we build our hospital, that is an attraction, and that's a way to retain our people here and increase their salaries, because they do a lot of hard work, and they need to be compensated for the value of their work.
Thank you, Governor. That will conclude our first segment, and we will begin a 5-minute intermission as we change between candidates to the Lieutenant Governor segment. Thank you very much.
We're gonna let's go to a commercial break first, and when we come back, we'll talk about. That was a pretty boring round, but we'll talk about it anyway.
Four years ago, we pledged to make healthcare more accessible, raise nurses' pay, and invest in our healthcare system. We have kept that pledge.
We increased income limits so that more families qualify for Medicaid, and we've made important advancements in telemedicine.
Our community health centers responded to COVID-19 while continuing to provide critical services.
The dedicated teams at our local and private hospitals provided quality, compassionate health care, even in the toughest situations, all while maintaining the highest standards.
Our healthcare partners, like our clinics, have also stepped up to answer the challenges, and we cannot thank them enough.
But if we are to provide the best in health services, we must build a new hospital.
Let's continue to move forward. We are all in this together, and we humbly ask for your vote. This is Governor Leon Guerrero, and I approve this message.
Funerals actually take a lot more planning than I expected. With us using island cuisine for the first time, of course we were iffy, but once they came and showed us their service, their food, tasted their food and everything, we definitely used them again because their service and food is just awesome.
are agents of change, shining the light on corruption, land scams, children being raped, growing violence, and the wrecking ball of poverty. While we have grown and been able to expose many of the dark corners of our islands because of the confidence you and our advertisers have placed in us, there still is so much more to do, so much more to clean. Kandit's flame must grow brighter. Fuel this fire. If you want the light shined on corruption in our governments, rape and violence against children and women, land scams and poverty, then advertise with us or sponsor our programming in Guam and the CNMI. Call us at 671-922-NEWS or email us at advertise@candidnews.com. This is the future. Fuel this fire.
Back. Listen, that was boring, all right? I don't think the needle moved anywhere. No one lost or gained votes in that round. It is more exciting in the comments section of the live feed. Thank you to all the commenters for keeping it active here. Well, I'll make my analysis real fast so we can get to everybody, all right? So I thought that Congressman San Nicolas missed an opportunity in the beginning with that, with the maternity ward. I thought that was a great setup for him to say, look, Governor, you've been in office for 4 years. You've had this money that the legislature appropriated. You didn't renovate the maternity ward. It's just that simple. And then he also had an opportunity. He sort of took it, but the governor came back and said, no, you're wrong about the tobacco taxes. But the congressman is not wrong about the tobacco taxes that are supposed to be going into the Healthy Futures Fund, and a portion of that goes to Guam Memorial Hospital. It really is a big issue that we're following here at Kandit. Other than that, I thought that the governor had command of healthcare. She was talking about the gastroenterologists and all those really fancy.
She had the
words
jargon.
Yeah, so she knows her stuff. I'll give her that, but otherwise just boring. Go ahead. Sorry.
Well, just remember now that she used to sit on the board at the hospital. There was a once upon a time, where, I want to say during the last administration, where she sat on the GMH board of whatever their operations were. So yeah, she's going to have some intimate knowledge and details of what goes on at Guam Memorial Hospital. I was waiting for. There were a couple of opportunities in front of Mike San Nicolas, specifically as I was talking about with Medicaid, because he brought all of that from Congress, got the numbers all straightened out and re-ratcheted for Guam, and then there was an issue with public health in that he didn't believe that they were doing enough to go and get more people from COFA into the system. So I'm actually kind of surprised that
he missed
the
that
numbers
opportunity as well.
Yeah. And of course, I thought Lou would have drawn a little bit more blood with her comments about him not doing the right kind of research. I thought that might be playing a little bit too close to the chest. At least that's the way I see it now. Ginger.
Yeah, well, I thought overall that the governor had the burden of talking about what she's been doing. And the one thing everybody's forgetting is in the middle of COVID, you can't do a lot to a hospital. I mean, we were talking about a period of time where intensive care was full of people that they were trying to deal with COVID. And I thought she was spending a lot of time defending the reality. And there was just a lot of spin from Mike San Nicolas. When it came to the issue of nurses, he didn't have anything to say. He was saying, oh, yeah, it really is an issue. But he didn't come up with anything concrete, where she had very specific things to say, like we need to increase the number of local candidates that can go to UOG and GCC to learn to become nurses. So I thought there was substance on her side, and I thought Mike is very polished. His spin is really there, but when you really look at the substance, it wasn't there at all.
Dr. Meenan?
Yeah, just near or far, and that is, Lou says move it to the other side of the island, Mike says keep it close. So I think there's a good, solid contrast there, and there are some other solid contrasts too. I thought it was kind of fun, by the way.
No, it was boring.
This is a niche audience kind of thing though too, but the question is, whose backyard is the new hospital going to be in?
Interesting point. And to that issue, you're right. I did kind of forget about the beginning of this, where they were talking about the hospital. Virtually every medical professional that I've talked to does not want it in Manila. They do not want it on Route 10, Route 15.
Well, let me just add something to that, okay? So the one thing that wasn't talked about, which the governor, didn't get a chance to bring up, is that Oka Point's too darn small. People are looking at this. This is the problem when we built the hospital where it is now. It's not big enough to be able to accommodate the island. And so the reason that they chose Eagles Field, and they did this with Army Corps of Engineers and everything, is because it's 107 acres. Oka Point just isn't big enough, and there was an opportunity, I think, to really make that point, because Mike San Nicolas is trying to say something about the governors want it to be there, and her point was it needs to be where it's large enough, and it needs to be where the population will be able to access it.
Patients only have 1 hour a day to receive immunization from public health services. What factors must be addressed in order to expand this necessary public service of immunizations?
Thank you for the question. I definitely am in favor of expanded access to immunizations. And of course, at the community health centers, you can get that regularly more than just an hour, as I understand. But part of the success of immunizations has been the partnership with the private sector. And in this case, we were able to achieve a high vaccination rate because of a strong partnership that had to do with empowering the private sector providers. I mean, we're a small island, so having a unified approach to trying to address infectious diseases is a critical thing. The other thing I would say is that our experience controlling and addressing tuberculosis had a lot of influence in our strategy and our method in getting the immunizations out for COVID. In fact, I wanted to recognize Chima over there, who received national recognition for the TB program that has been built at Public Health. But I would say that for immunizations, it's expanded and very liberal hours in the government, but empowering in partnership with the private sector. Thank you.
Thank you, Lieutenant Governor. Mrs. Salas-Metanani, you'll have your 1-minute rebuttal.
Well, I think it's absolutely unacceptable that immunizations are offered 1 hour a day at our community health centers. I think that it should be expanded to 8 to 5 when they are open and offered 8 to 5 at all 3 immunization clinics or at all 3 public health community centers.
Thank you, ma'am. Lieutenant Governor, you will have your 30-second response.
Thank you. And just to clarify, you can get on-demand your immunizations at the community health centers, those public health clinics. In fact, the next phase, our strategy for community health centers, is to give them some autonomy and to let them be able to operate real fast. And I think that's going to increase and improve their effectiveness as well. Thank you.
Thank you, Lieutenant Governor. The next question will be for Mrs. Salas-Metanani, and this is in regards to hospital accreditation. So in 2018, Guam Memorial Hospital lost its accreditation status, which has made it difficult to acquire certain federal funding which could help support the hospital. How would your administration work to regain accreditation for our hospital? Oh, your 2 minutes will begin now.
I remember that reaccreditation was a goal of this particular administration. And here we are 4 years later, and our hospital is still not reaccredited. I think there are steps and things that obviously what we need to do to get it reaccredited. I think one of the things that this administration did was we went from the Joint Commission that was accrediting GMH and switching it to a whole nother organization. So yes, absolutely, reaccreditation for the Guam Memorial Hospital is a top priority for Mike and I.
Thank you, ma'am. Lieutenant Governor, you'll have your 1-minute rebuttal.
Accreditation took a long time to happen at GMH, and our governor and our current hospital administrator both were on the board that got accreditation for the hospital. And it was a shame that it was lost in 2018. But we've been looking at the reports. Our team has been looking at all of the deficiencies that happened back then, and they have been executing a plan to regain accreditation. And this spring, the accreditation team will be coming for its initial visit to put us back on a course for accreditation. I think our administration has the credibility to get it done. After all, we were able to successfully reaccredit Guam Behavioral Health and Wellness Center. We have a very, very good system in place. We have fine individuals at GMH that were responsible for accreditation. The accreditation was lost because of past leadership failures. That leadership has definitely been revisited. We have strong leadership, and we are going to have that hospital accredited.
Thank you, Lieutenant Governor. Mrs. Salas-Metanani, you'll have your 30-second response.
I think it's great that you guys are going to try and get the hospital reaccredited. That's really all I have to say.
If that concludes the response, we'll go ahead and move on to the next question. So this is for Lieutenant Governor Tenorio, and this is going to be about mental health. So during the pandemic, the island saw a rise in demand for mental health services. Despite that, behavioral health has been challenged to match this demand due to a lack of resources available on the island. If reelected, how would you proceed forward to address our current mental health resource shortage?
I have my hand and my pulse on mental health. I have a regular meeting with their director, trying to make sure that we continue to give them the resources. And that really has been responsible for an increase in the behavioral health, mental health spending by more than 26% from the last time that the Republicans were in charge in 2018. On top of that, behavioral health has, under our leadership, received for the first time and now expanded direct grants from the Substance Abuse and Mental Health Services Authority out of HHS. It's based on credibility that was refreshed and partnered not only with our behavioral health, but with our nonprofit organizations. There's a considerable amount of work that has to happen, and some of the things that we're looking forward to in addressing this COVID situation is expanding into the schools. We have a strong partnership that we have established with the Guam Department of Education. We have school counselors that are now interested in getting licensed and getting the hours with behavioral health so they can go in and do clinical work. That is also going to expand the number of mental health professionals that we have. On top of that, we're introducing an app this fall, Safe GU app, targeted to kids, that's going to allow them to anonymously report behavioral concerns, public safety concerns, suicidal ideations, all these things that sometimes juveniles or young adults don't want to report because they don't want to get blamed. This, in concert with a leadership that has also got behavioral health to be designated federally as a place to receive mental health professionals. There are 3 mental health professionals that are inbound this fall, and we're going to be counting on that and expanding the progress so that we can expand mental health services.
Thank you, Lieutenant Governor. Mrs. Salas-Matsanani, you have your 1-minute rebuttal.
Look, my niece committed suicide, so I know the problems at mental health. And during the COVID pandemic, there were so many people that I had spoken with and interviews that I've done with people that were so concerned and worried they didn't know where to go. And so our opponents, clearly he's going to get up here and he's going to say they're doing a great job. But the fact remains that they don't have enough full-time psychiatrists to treat patients that are in need of this service. They have a full-time psychiatrist that is on vacation, and we don't know if he's going to be coming back. They've hired a doctor part-time. They've hired a nurse practitioner. But signing off on prescriptions is not the way you treat the problem at the agency. You need medical professionals, a team of psychiatrists. Now imagine if this administration put more focus on fixing the problems instead of fixing an election by hiring non-essential staff at the Guam Behavioral Health and Wellness Center. Thank you.
Thank you, ma'am. Lieutenant Governor, you'll have your 30-second response.
I have to say that we have excellent staff at Guam Behavioral Health and Wellness Center. I'll proudly protect them from any political attacks. The leader of my opponent's team could have done his part as a congressional delegate by providing a pathway to designate Guam and give them the designations to expand the number of medical health professionals that could come. There are certain federal designations that can be made through HRSA and other organizations. So, if you want to be part of the problem, then be part of the problem. I'm part of the solution.
Thank you, Lieutenant Governor. The next question will be for Mrs. Salas-Matsanani. It's in regards to outdoor facilities. So with the growing concern for people's physical health, doctors are now more than ever recommending for their patients to go outside and exercise. If elected, how will your administration provide access to safe and clean modern parks and recreational facilities? Your 2 minutes will begin now.
Well, because I am from the village of Agate, I just got a call from my uncle the other day. They were wanting to hold a barbecue at Nimitz Beach, and they paid for the fees, but Parks and Recs told them, maybe you shouldn't do that. Go to EPAL, because there's no power, there's no water, and the restrooms are locked. So if we want to have outdoor activities, especially at our public parks, then we should actually clean them and not just talk about investing $50 million in a smart park in Tumon for tourists.
Thank you, ma'am. Lieutenant Governor, you may begin your 1-minute rebuttal.
Thank you. There's a significant investment going on recovering parks and recreational areas throughout the island. considerable amount of outdoor fields or getting those covers and still open air so that we can mitigate against some of the threats that we've been seeing in the last few years. Down at Nimitz Beach, one of the big things that's happening is we're losing the shoreline. And we're working with the Army Corps right now to restore that shoreline and make sure that that park is going to be presentable. Once the investment is made, we intend to transfer that park under the direct jurisdiction of the Agate Mayor. And we always find that empowering the mayors and giving them the resources to be the first responders is the way to go. And that's the direction that our administration is heading to. One thing, though, I have to say is on top of providing facilities, we provide programs. And in these last couple of years, we've been able to provide resources to nonprofit organizations like Clutch and others that are out there recruiting youth, coaching them, and getting them to be more active.
Thank you, Lieutenant Governor. Mrs. Salas-Matanani, you'll have your 30-second response.
Look, I'm not a politician, so I'm not going to come up here and give all these savvy answers. Clearly, you saw I kind of flopped on some of them earlier. But what I know is that it's not just Nimitz Beach, it's other parks in our community that need to be improved.
Thank you, ma'am. We'll move on to the next question. This will be for Lieutenant Governor Tenorio. And this is also another question about healthcare coverage. So, migrants from the Federated States of Micronesia remain among the most affected by disparities in health on our island. This is further exemplified by the disproportionality in deaths that we witnessed during the COVID-19 pandemic, and we still witness today. With the passing of the Consolidated Appropriations Act of 2021, Medicaid coverage has been expanded to all of these migrants who come to Guam as part of the Compact of Free Association. How do you plan to leverage this federal program to help this community overcome these health disparities, and what are the main challenges you believe need to be addressed?
Well, one of the things we're doing already is migrating folks and bringing them up. Right now, we have already registered 4,933 COFA citizens into the Medicaid program. That, on top of another population, means that the total folks from Micronesian descent on Medicaid are 13,141. We know that this population has the problem with access to health care, and a lot of that has to do with some of the conditions that they're living in. So some of the other work that needs to happen is improving infrastructure. We have a big infrastructure project we're working on to provide water and wastewater to all of those residents up there that were swindled and were given lots without all of that up there in Jigo. But back to Medicaid, what we're doing right now, working with our health advisor, Senator Rodriguez, we've expanded the number of folks that can receive those applications, dispatching them at our relief center also, and the mayor's office to make sure that these applications are complete and we can catch up with a couple-month backlog that we've seen as a result of this interest. I want to also say that right now, the future, based on geopolitics, there's a lot of interest from our federal partners to make sure that our COFA citizens that are living here and elsewhere in the states are going to be receiving proper benefits and proper coverage. This includes veterans who are underserved and not served living elsewhere. And so some of the discussions that we're having at the highest levels with our federal partners are utilizing and taking advantage of the geopolitics and bringing in more opportunities so that we can expand the kind of services and also partner with our local private sector medical partners to help expand the kind of work that they can do elsewhere. Thank you.
Thank you, Lieutenant Governor. Mrs. Salas-Matanani, you'll have your 1-minute rebuttal.
First, thank you to Congressman Michael San Nicolas for his efforts in availing eligibility for FSM citizens into the Medicaid program. The problem now, though, is, from what I'm hearing, is public health is not processing the paperwork quickly enough. We hear some have been waiting up to 6 months, and it's not just our COFA brothers and sisters waiting either. What we propose is mobilizing a Medicaid action corps of detailed non-essential GovGuam workers to provide end-to-end support for the over 10,000 families that are eligible for coverage but do not currently have the support that they need to enroll into the program.
Thank you, ma'am. Lieutenant Governor, you'll have your 30-second response.
They probably need to check their numbers and update them because I think I've already showed you that we made some tremendous progress. But of course, things are not perfect, and those are things and areas that we go and bring attention. And part of this is empowering nonprofit organizations that are out there in the front lines to give them the authority to receive these applications and doing clinics. Last thing I want to say, fortunately, we had the migration westward by COFA citizens into Oregon and Washington and Arkansas gave us finally national attention to get this done. It wasn't the congressman that was leading the effort.
Thank you, Lieutenant Governor. We're going to move on to the next question, and this is going to be for Mrs. Salas Matanani. This is in regards to a physician shortage. So I'm about to start my training as a physician, and I have a lot of peers who are also about to start from Guam as well. And so I'm committed to returning to the island, and a lot of my peers are as well, and I know a lot of these physicians out here had peers as well who were committed to returning to the island. But there are some difficulties that are encountered along the way. The question is, how do you intend to create programs that will entice future homegrown physicians like myself to return to the island? Your 2 minutes will begin now.
Well, first, thank you for wanting to return to Guam because we definitely do need doctors here. I know that in conversations that we've had with some of the physicians, there are some issues with, I think it's licensing and visas. And so I think we need to continue those discussions with these physicians because for me, I'm not an expert in healthcare, but I am a good listener. And so that's what I plan to do, and Mike and I plan to do, is work with all of you in this room that are medical professionals to figure out a solution so that we can recruit and retain more physicians for Guam.
Thank you very much, ma'am. Lieutenant Governor, your 1 minute rebuttal will begin now.
Thank you. We have a partnership going on right now that is identifying all the different things that we can fold into a strategy to address the physician shortage and really try and support all of the physicians that are going out there. In fact, just listening to Dr. Alfred and listening to the peril she received when she got the ProTech scholarship, then was sort of discouraged from going into getting her specialty care because of some bureaucracy. But I think reforming those, and we're on a path to do that, plus we've seen now that we can use a digital infrastructure and virtual means to fast-track licensing in a very responsible way. We were able to do that during the COVID pandemic. And I know that the Board of Medical Examiners, and in particular Dr. David, is focused in on those improvements. And I think that continuing to work with the private sector also, some of it could be that the hospital or public health has duly employed folks, duly employed in the government, duly employed in the private sector that give them the financial means and the patient and the expanded patient base to do a good job.
Thank you, Lieutenant Governor. Mrs. Salas Matanani, your 30-second response.
I think what we can also do is implement a federal program that is used to recruit physicians to come to remote locations such as Guam. From what I understand, that there are certain things that the Guam Memorial Hospital has to do in order for us to be eligible to implement that program. And so I look forward to working with the GMA and the GMS on that.
Thank you, ma'am. The next question is very similar to what's been discussed so far, and it's about the physician loan forgiveness programs. So this one will be for Lieutenant Governor. Some off-island providers are interested in practicing in Guam, especially at the community health centers as part of a loan repayment program. However, they find other jobs during the time it takes to process and hire them. You might have mentioned this already, but maybe expand a little bit further. How does your administration plan to streamline the hiring and credentialing process for interested providers?
Well, a couple things first. Let me just say that community health centers, we're working with the chairs of the North and the South to come up with some legislation that is going to give the community health centers some autonomy and let them operate kind of similar to how they're operating in the CNMI. Still, of course, strong support with the Department of Public Health, but give them the authority and the flexibility to really respond and get through some of the bureaucracy that the line agencies go through. With regards to licensing, I really do think that it has to do with technology. And I think that right now the Guam Board of Medical Examiners is working on a pathway looking at our COVID experience and implementing some long-term reforms. There have been already some long-term reforms in some of the other licensed areas that have been caused because of the COVID situation and our need to bring in and fast-track credentialing, especially from the military and traveling folks that came in during the height of the emergency. But it's going to be that, but it's also going to be making sure that we protect our physicians from irresponsible legislation that would open them up for baseless accusations. And so recent legislation that has been proposed, most, if not every single medical provider is coming out there talking about how this is going to jeopardize Guam being a place, a safe place for physicians to practice. And I think that there, of course, is going to be an improvement when we're able to give people a faster, quicker opportunity to address legitimate claims against physicians. But that being said, you have to make sure that we listen to the physicians and protect the integrity of their practice and protect them from any allegations that are baseless. Thank you.
Thank you, Lieutenant Governor. Mrs. Salas-Matanani, your 1-minute rebuttal.
Can you repeat the question?
Yep. How does your administration plan to streamline the hiring and credentialing process of interested providers?
I think I want to just follow up on what Josh said because I think he was referencing arbitration. First, I wanted to say that Speaker Teresa Lahi, Telo Taitagui, I appreciate their relentless efforts in trying to resolve the issue and also come up with a compromise because I think that we don't want to ignore the voices of the patients and the people of Guam that are concerned about the high cost of arbitration. And from what I understand, there is a compromise on the table with respect to licensure. So when a physician renews his license, they would pay a certain fee. That fee goes into a fund. That fund is matched by the government of Guam. Someone who files a complaint or feels that they've been wronged would be able to access that fund if they meet certain income criteria. And if they win their case, then they would pay that money back into that fund. If they lose that case, then they wouldn't pay anything. So there would be zero cost.
Thank you, ma'am. Lieutenant Governor, your 30-second response.
Thank you very much. I'm glad to hear, and we'll make sure that any changes to the legislation are going to be endorsed by our medical professionals. They need to make sure that they're part of the solution to this. And there's no question that there has to be an improvement to patients. Guam patients are people having a good process to pursue legitimate complaints. But these we have to make sure that we understand everything all the consequences of the changes and make sure that we get our doctors on board with them. Thank you.
Thank you. And may I refer to the timekeepers? May we have one more time for one more question for this segment? All right. So this next question will be for Mrs. Salas-Matanani in regards to physician shortage, particularly with women's health and prenatal care. So Guam has one of the highest infant mortality rates in the nation. We are limited in prenatal care providers and currently have no neonatologists at GMH. How does your administration plan to address this issue?
I think that question should be posed to the Guam Medical Association and the Guam Medical Society because, again, I am not a medical professional, so I don't know all the inner workings of how you manage and do what you do. So that will be one of the things that I plan on doing if I'm elected is actually working with you and listening to you because you guys hold the solutions.
Could you repeat the question?
Sure. With no neonatologists at GMH, how does your administration plan to address this issue that's very important for the prenatal care of our island's mothers and children?
I think that it's very critical that we provide adequate facilities and a good patient base in order to attract specialists like that. And so in addition to what we talked about in the last round of questionings, making sure that we have adequate protections for them, and also making sure they have a good patient base, we also need to make sure that we provide them with the facilities. And certainly building a new public hospital is going to provide them with that facility and support, technology, and all those things that are necessary for a practitioner to really excel at their practice. The other thing, though, with regards to women's health, I have to say that part of women's health is women's reproductive health. And I just have to take this opportunity to say that I really do think the governor and I, of course, are both very protective of women's reproductive health. And we want to make sure that that, as an option, continues to remain on Guam for them. Thank you.
Thank you very much, Lieutenant Governor. Mrs. Salas-Matsinani, you have your 30-second response.
I don't have a rebuttal.
All right, with that, we will go ahead and conclude this second segment, and we will begin a 5-minute intermission again. So thank you very much.
Thank you.
Four years ago, we pledged to make healthcare more accessible, raise nurses' pay, and invest in our healthcare system. We have kept that pledge.
We increased income limits so that more families qualify for Medicaid, and we've made important advancements in telemedicine.
Our community health centers responded to COVID-19 while continuing to provide critical services.
The dedicated teams at our local and private hospitals provided quality, compassionate health care, even in the toughest situations, all while maintaining the highest standards.
Our healthcare partners, like our clinics, have also stepped up to answer the challenges, and we cannot thank them enough.
But if we are to provide the best in health services, we must build a new hospital.
Let's continue to move forward. We are all in this together, and we humbly ask for your vote. This is Governor Leon Guerrero, and I approve this message.
Funerals actually take a lot more planning than I expected. With us using island cuisine for the first time, of course we were iffy, but once they came and showed us their service, their food, tasted their food and everything, we definitely use them again because their service and food is just awesome.
Welcome back. And, so this round was better than the last round. It was less boring than the last round.
Okay, what did you like?
Well, let me just say and express my biases like I do for our audience, that I'm a Mike and Bree supporter.
Okay.
And I think this is one of the reasons why we invited Ginger to come on, was to balance this out, right? And I want to set aside the question where they answered about the Medical Malpractice Mandatory Arbitration Act, because I have very strong feelings about that. And of course, I agree with Sabrina Salas-Matsinani's response to that. I disagree with the Lieutenant Governors. But I have to be honest, the needle did move in this round, and it moved in favor of the Lieutenant Governor. I love Sabrina Salas-Matsinani. She did get a couple of pretty good dings in there. The one that I liked the most had to do with the hiring of non-essential employees. If you really care about mental health so much, what about the hiring of all these non-essential employees? But it came after a very good response by Josh Tenorio about the mental health situation on this island. And generally, throughout all of those answers, Josh Tenorio provided pretty good answers. And Sabrina Salas-Matsinani, I think the charm that she brings is that she's not a politician. And she said so quite a few times. But if we're being real here, the needle moved toward the Lou and Josh team.
I thought Sabrina was a little bit more aloof than I like to see her, but clearly, and I'm going to agree with you on this. I think Josh did an excellent job. It's clear that he's in the weeds in some of these issues and working and especially over at mental health, where they have been critical. They do have some critical issues and shortages that Bree did talk about. I was a little bit disappointed at the end when they were talking about neonatologists, and you guys between Ginger and Ron, on, we've got a couple of answers for them, and one of them is for in a lot of cases with some of our migrants, the first time they see a doctor is when they're actually delivering the baby. There needs to be a little bit more by way of outreach into that community and others when we start talking about that. But he said, well, we'll build a better facility for them, and I'm going, that's 5 years down the road. We need the neonatologist in the building and working on the moms and the babies now.
Yeah. So a couple of things I'm going to say. I mean, I think one of the imbalances that you have is you have the team of Mike and Bree who are able to just sort of say anything really without the problem of having to understand all the things that it takes to do that. So a lot of times Bree will say, well, we just need to hire more doctors. No concrete plan. I mean, it's almost as if, Lou and Josh are sitting around not trying desperately every single day to hire those doctors and struggling with all of the real life issues of doctors not wanting to come out to Guam, there being an international shortage of doctors. I mean, they're burdened by the truth, and it's really easy for her to just kind of say, oh, okay, well, here would be the solution. But I think one of the fundamental things, too, is...
that's going to be the case every time we're talking about an incumbent and a challenger. The other thing that I'm always surprised about is
Bree always says, well, I'm not a politician. Well, her running mate is a politician. I mean, that's the whole point. In fact, the only thing that Mike St. Nicholas has ever been is a politician.
Well,
and
he
if
was a
you
banker.
look,
he was a banker before he was in politics.
Not a banker per se. I mean, he worked for Lou's organization and didn't do anything of substance really. So, and if you look at Lou and Josh, I mean, Josh has been a court administrator. He's been in the private sector. He's done a lot of other things. Lou has been taken a bank to $2 billion. She's been a nurse. So when you're looking at that and then you're listening to Bree, she didn't have the answer. She didn't even answer the question. So let's go back to one important thing, and I think that showed in the performance that you saw here today. Sabrina, for 25 years, was at KUAM. And what did she do at KUAM? And I can speak to this because I was at KUAM before that. Okay, and when I was there, it had 90 minutes of really killer news, and it was amazing. We did 1 hour, and then we did half an hour at 10 o'clock. I mean, it was a vibrant organization. And in 25 years, it just went completely downhill. I mean, I love seeing it now because you're seeing Hannah and some, Nestor kind of try and bring it back, but it just caved. So if you're talking about experience versus experience, her answer is, I'll listen to you. Well, I mean, just look at her job performance over the last 25 years.
I'm
and
a good listener is not an answer.
I'm a good listener is if you're going to run an island that has a $2 billion economy and you're talking about really huge problems. I mean, we're talking about critical, when you make these decisions about doctors and where to place hospitals, it's life and death for 150,000 people that live here. And you need people that are serious. You don't need politicians. Mike St. Nicholas is a politician and she's slamming politicians. And you don't need people who did poorly in the media saying, well, I'll listen to you. You need people who actually have the experience, because at the end of the day, when it comes down to an election, it's not a popularity contest. You don't have a popularity contest for a guy who's going to fly your plane. You shouldn't have a popularity contest about the person who's going to guide an island when your life and your livelihood and your health are all at risk. And so I think there was a clear comparison between Josh's command of the subject, which also showed when Lou was talking, and Bree saying, well, I'll listen to you, and I don't have anything further to add.
This sounds like the rest of the platform for the Leon Guerrero Tenorio administration. Go ahead, Doc.
So why do people vote, and how are people influenced? And that's something we study a whole lot. It's not the words that they're saying, it's how people feel about them when they're listening to the words. And so one thing that Bree said, and she had the courage to say it, she talked about her niece's suicide and how in the context of mental health that made it real for her. Everyone who knows Josh knows that he believes genuinely in all the things that he's talking about. And so what happens is in the voting public, when people latch on and they identify with these candidates, they do so not on the thinking level, but on the feeling level. So the question is, how do people feel about them? And that becomes the actuating point for the vote.
So it's a lot of times it's about that connection.
And what they see, not what they hear. And how often do people say, I could care less about this question? How many times did the public say that to themselves?
I said that a lot to myself tonight.
So if Bree's saying, basically, I have no comment, she's saying, I could care less about that question. And that kind of rings with a group of people. On the other hand...
be relevant.
And be relevant. And Josh was making really good points that were very insightful and shows that he has the policy on these kinds of things. So it's a really good contrast, I think.
Well, they're all Democrats, so if Mike and Sabrina win the primary, then they can hire Josh because he seems to be very, very experienced in all of these matters. There was a question that was relevant
vice
to me.
versa.
Or vice versa. But there was a question that was relevant to me was the one about going outside, because I'm almost positive I gave that to Vince Akimoto the other night. Because I think it's important when we start talking about healthcare. Exercise is medicine, and being able to have access to great park facilities is essential. I think to being able to get people and encourage people to go out there and do more of this stuff. And I'm so supremely disappointed in both camps because neither one of them mentioned the atrocious situation that is affecting just swimming pools. We cannot, in the government of Guam, keep 2 swimming pools working. What's the matter with us?
Well, part of the reason is nobody swims in a swimming pool. Everybody swims in the ocean. But anyways.
Well, I think you're giving your team a little bit of a pass, Ginger.
Yeah, easy.
No, but one other thing that I thought, and I think Dr. McNitch made a really good point, and it's about feelings. And one of the things that I'm getting, I know I'm on a certain camp, but I will say this. Sabrina just seems
who did
depressed.
better news?
No,
Ginger Cruz
I'm not saying it's better news. I'm not saying it's better news. What I'm saying is you judge people on their record, right?
Sure.
And Mike and Bree have made a big point of saying you judge Lou and Josh on their record.
Sure.
And so if we're going to be fair, then everybody has to be judged on their record, right? You don't get a buy on that. And so you need to look at a person's record and say, is that a person who did a stellar job? Or is that a person who's optimistic? Is that a person who's seeing the possibility of what can happen on the island? Or a person who's wallowing in all the things that aren't happening and really depressed about it?
Well, there's something to be
and
said
I
about
feel
that.
that.
So in terms of that energy, right? Mm-hmm. I think there's something incomplete in this debate coming from the Mike and Bree team. It's that bringing it right back to, because the criticisms are there. Sabrina says, you did this with mental health. What about the COFA migrants? And Mike said, the thing about compact assistance, all that stuff, right? But they're not wrapping it up at the end and saying, why didn't you do that, Governor? Why didn't you do that, Lieutenant? It's almost like they're holding back. Why are they holding back?
Okay, but instead of saying, why didn't you do that, Governor, why don't they wrap it up with concrete reasons of how they're going to do it? Like they have all these ideas. Oh, well, we would do this, we would do that. No plans for how to get the resources to be able to do it. They're very complex issues, and having an answer that has substance to it is something that I haven't heard yet from them.
We are going on the final round of the debate. It's going to be all 4 of them.
Ooh. Pose down.
WWF. So both candidate teams could join me in the middle for the coin toss. So we don't have the special coin this time. I had to ask Dr. Bo to borrow this, so we're going to reimburse him later. So we'll begin with Governor again. So heads or tails? All right. Going up. It is heads. Would you like to punch or receive? Okay, punch. So this segment will feature both team members from both camps, and at the discretion of the team members, they can decide who will respond to the question. They can go back in between, but it's going to be the same time segment. So 2-minute response, 1-minute rebuttal, then 30-second following response. Right. Okay, so the first question will be for the San Nicolas Salas Matanani team, and it will be in regards to infectious disease control. With the COVID-19 pandemic, we learned that there are many limitations within both the public and private healthcare services. How does your administration plan to prepare private healthcare facilities for infectious disease outbreaks on our island?
Well, Bree and I know that a lot of you folks in the private sector have made your own investments to kind of adjust how you do business because the COVID situation is still very real, as evidenced by all the masks in the room. And infectious diseases are going to continue to be a reality of the human condition, time eternal. So these investments that you've made are definitely sound investments that are good for your patient base and good for our community. But Bree and I firmly believe that those kind of investments need to be supported by the government. I understand that there are a number of you private practitioners out there who've incurred costs to put in these safety precautions, and you haven't necessarily received the federal support that's available to you to be able to offset those costs. So those kind of things need to be more fluid, they need to be more transparent, and they need to be more readily available. But it's a matter of making the necessary investments. And of course, in the private sector, you folks will be making the investments as you see fit. But as medical professionals, I believe that decision within your own capacities is going to be something that you're going to be able to make at the base level. I mean, Bree made it very clear tonight that we want to listen to you folks. We want to listen to the GMA. We want to listen to the GMS and the medical community. And so communicate. Let us know exactly what we need to do on a policy level, on a financial level, to get those safety precautions in place. We'll continue doing what you're doing, and we can support it as much as we can on our end.
I believe you have 30 seconds remaining if you would like to continue the response. Otherwise, we can move on to the rebuttal. So, Governor, you may begin your 1-minute rebuttal.
Can you repeat the question?
Yes, ma'am. So, how does your administration, if reelected, plan to prepare private healthcare facilities for future infectious disease outbreaks on our island?
There are definitely going to be future outbreaks in our island. We're looking at monkeypox as a potential. At our public health community center, public health services, we have an infectious disease unit. And these infectious disease units have a very strong communication and relationship with the clinics. We have worked very closely during this pandemic with the clinics. In fact, we stood up a Cures Act where we used and helped, the clinics to help us with the testing, with the vaccination, with the tracking, and certainly we invested in those private clinics. We've invested monies into their infrastructure. We've invested money into their the vaccines, and we've invested money into their testing programs.
Thank you, Governor. Congressman San Nicolas and Mrs. Salas-Matanani, you may have your 30-second response.
Well, Bree and I, when we listen to the responses, we're just a little dumbfounded because these answers are coming directly from the constituents. They're coming from the clinics. They're coming from you doctors out there and you private practitioners. You're the ones who are telling us that these things are not happening, that this support is not coming your way. So, debates are interesting things because people can get up and say one thing or say another, but you guys know what your realities are. And those realities are what needs to get addressed. Bree and I are committed to facing those realities and addressing them with you.
Thank you, Congressman. We'll move on to the next question, and this will be for the incumbent team. And this question is in regards to abortion. So with the overturn of Roe v. Wade by the U.S. Supreme Court, the issue of abortion has been left in the hands of the states and the territories. What will be your administration's approach with respect to abortion policy?
Thank you very much. Josh and I are very solid on our position about women's health rights and women's reproductive rights and women's right to privacy and women's right to confidentiality. We're very solid on that position. The day that Roe v. Wade was overturned was the dark day for women. It has set back women's health years of fighting and years of going forward and years of making sure that our constitutional rights are protected. It's unfortunate that Roe v. Wade has been removed. If there is any legislation that in any way restricts the woman's right to health and privacy, I will veto that legislation. I will work with our women's group. I would work with our healthcare providers. I would work with our healthcare facilities to make sure that healthcare is provided for the reproductive health of our people. I will make sure that abortion becomes legal. I will make sure that abortion is done in a safe, legal, and hygienic environment. I have gone through the age where I have seen women in ER hemorrhaging from back alley abortions. We do not want to go that route. I implore the legislature and I implore the people of Guam to please protect our women's right to reproductive health. And if there is legislation that comes down that restricts that legality, then I think it should go out as a referendum so the people of Guam can have their input and the people of Guam can decide through referendum.
Thank you, Governor. Congressman and Mrs. Salas-Matanani, you may have your 1-minute rebuttal.
Thank you, Kai. This is a very sensitive issue in our community, and on both sides, there's merit to the issues. Bree has expressed that she's definitely a pro-choice individual, and my wife and I, our family, we're pro-life, and it's just a hard issue for our community to deal with. Roe v. Wade did something very specific, the overturning of it. It put the issue to the states. It put the issue to the territories. What we need to do responsibly as leaders is we need to put the question to the people. We need to ask a very direct referendum question. Do you want your local government to pursue pro-choice or pro-life policies? And let the people give us very clear guidance. Because as we navigate this difficult issue, it's going to be something that we're going to have to come together as a community on, and it's going to require community's input. So let's put that question to our people. We really should not delay. Roe v. Wade's already been overturned. Let's get clear guidance. And then from that guidance, our policymakers can begin to make the necessary policy decisions around the very direct information that our people provide for us in that referendum.
30 seconds response, Governor.
Certainly, I agree that we should put it out as a referendum and get the people's input and get the people's desire. I will guarantee you that the people will say, let's protect the rights of women to reproductive health, the rights of women to privacy, and the rights of women to confidentiality.
Thank you, Governor. We will move on to another question, which is also pertaining to women's health. Again, hearkening on the theme of physician recruitment and retention. So this question will go to the St. Nicholas team and Sabrina Salas Metanani team. With only 3 full-time and 4 part-time obstetricians on the island, it can take 15 weeks to get an appointment, meaning many women will not be able to see an OB in their first trimester. What factors would you consider in addressing this shortage in women's health specialists?
You know, a lot of the questions are very similar about the issue of recruitment and retention. You know, what are we doing to bring these professionals over here? What are we doing to keep them here? And we've talked, both sides, both of us tonight have talked about the need for us to focus attention and resources on that issue. And Bree's made it very clear that we need to ask you folks too. I mean, if you're an OB here and you're staying here or you came here, what brought you here? You know, what made you want to stay? And if you're considering having to move, you know, what could keep you here? Or, you know, if you know, you're dialed into the industry, what are your fellow industry professionals looking for? You know, that's why when Bree brings to the table the listening component and just being very real about the issue, it's just so valuable. Because as politicians, this is something she taught me. You know, we have a tendency to try to always be the one to go out there and say, this is what you need to do, or that's what you need to do. But when it comes to recruitment and retention, she's right. You know, we need to ask you guys, how do we get you guys to come? How do we get you guys to stay? What is the industry looking for? And then focus things on that end. Sometimes, you know, we get very focused on the issue of compensation. The reality is that's always going to be an issue. But what are some unique things that we can explore? You know, maybe housing allowances for those kind of professionals, something that other places aren't doing that we can do here to make us a more unique destination. Those kind of conversations are conversations that should be had. But I think that first and foremost, Bree's right, we got to listen. And we got to get the advice from you folks on where we're going to be able to be most effective in deploying resources to recruit and retain for these kind of critical positions.
If there are no additional remarks, we'll begin the 1-minute rebuttal.
There is a crisis in the maternal child health part of the specialty. It is a crisis of great concern. Josh and I have impaneled a group of physicians represented from the private and the public sector. And we did our first meeting and a roundtable discussion. And the group brought forth many ideas, from bringing in locum to working and contracting with hospitals to provide those specialty on a regular rotating basis, to improving licensing processes, to improving hiring policies, and of course, building a new hospital and making sure that the equipment and the resources are there to make it available for our doctors to perform. And let's make our island more a doctor-friendly island.
Thank you, Governor. There will be a 30-second response now.
You know, we try to be nice. Bree's a little bit more on the her agate side, comes out more than I do. But you guys had 4 years to do this. You're only talking about planning it now. You've had all these you've been the most funded administration in the history of Guam. You've had the most power over emergency powers you still have today. And this is still something that you're only now going to be planning and discussing. You know, we need to talk with you guys and we need to get your input, but we need to act, and it shouldn't take 2 terms to do it.
We'll move on to the next question. And this is in regards to specialty care recruitment. This will be for the incumbent team. So, many patients from Guam require specialized health care to resolve their complex conditions, but the specialists required to perform these therapies and operations are only accessible alongside the hefty expense of travel. How do you intend to attract specialized healthcare providers and all their ancillary requirements to practice their specialties and subspecialties on Guam?
Of course, again, like in the past with your questions, this is very similar in past questions. Specialty care, like I said, first, we need to make sure that we know what specialty care we need to bring over. After that, we can work with various hospitals off island. We can work with various universities off island to create a working agreement so that they can come on a rotating basis. A lot of times, the fact that there's not that volume here to provide for that specialty care is a barrier. So one of the things that we are doing is we are working with the other Micronesian islands to also make sure that we can share that specialty care with the other Micronesian islands, CNMI, Pohnpei, Palau, RMI, and so forth, because they too have a lack of specialty services. On the local side here, we can also provide some funding to help them with their travel. We can provide some resources to help them much more be convenient in coming over here. We can provide them with housing while they're here so that it is not a barrier to getting here. We are already doing this, by the way, at the hospital. We are sharing a specialty right now with neurology, with GRMC and GMH. We know a cardiologist from Good Samaritan who comes here on a rotating basis every 3 months that works with Dr. Hanaba in terms of cardiology. We know of people that come in for rheumatology, for gastroenterology, working with the other clinics to make sure we share that specialty care, because the goal is to provide services to our people.
Thank you, Governor. Mrs. Salas-Matanani and Congressman San Nicolas, you may have your 1-minute rebuttal.
Kai, could you repeat the question, please?
Yes, sir. How does your administration intend to attract specialized healthcare providers and the ancillary services that would come along with those subspecialties to practice their subspecialties and specialties on island?
Again, this is, as the governor mentioned, this is very similar to some previous questions in terms of recruitment and retention. Getting specialists here and having them permanently stationed here is absolutely the ideal. There are some realities that we need to have a very serious conversation about, and maybe the doctors and the medical professionals can help us to figure out those realities. But one of the bigger realities is patient volume. You know, if we're going to bring in a certain specialist to be able to provide a service here on Guam, is the patient volume going to be there for them to actually sustain a practice? You know, if those patient volumes are there, then by all means, you know, what's holding us back? Let's get to the root of the problem, figure out the incentives, and figure out where to go and find the expertise. But if we're talking about a challenge of patient volume, then we have to have a conversation with our medical professionals and say, hey, you know, so what kind of scheduling do we need to work out, and how do we need to find these kind of professionals to get here, and on what basis? How do we marry the ability for us to create incentives to have people come and not have that permanently stationed here where they're not going to be able to make a living?
Thank you, Congressman. The 30-second response.
I just wanted to add that in the last question, I almost felt that we weren't in reality. I mean, we've been in a pandemic for 2.5 years of the 3.5 years we've been in office. Had the congressman even been present or even call us for help, he'd know that our primary focus has been to save people's lives in the pandemic. And we've been able to do this and try and find pathways to increase our recruitment and retention efforts, not only for general physicians, but for those specialists. Thank you.
Thank you very much. We'll move on to the next question. This one will be for Mrs. Salas-Matanani and Congressman San Nicolas. In regards to healthcare facilities. To reduce the cost of healthcare and attract more health professionals to Guam, do you support exempting clinics and private healthcare facilities from the business privilege tax? Please be specific in the factors that you would consider in that decision. Your 2 minutes will begin now.
Bria and I are just like, yeah, yeah, we would. I mean, why wouldn't we? You know, those kind of incentives are common sense incentives. So we absolutely should do the business privilege tax exemption for the medical professionals. We should look at other business privilege tax exemptions to help bring down the cost of living here on Guam for food and medicine, and figure out how to marry those of our bond covenants, that we can actually do that and help to make Guam more livable again. You know, when it comes to dealing with a pandemic, and when it comes to bringing solutions into our community and deploying resources effectively, can you imagine if California just didn't do anything because they had to deal with the pandemic? Can you imagine if Texas or New York or any of these other, you know, states that all were dealing with a pandemic just didn't accomplish their goals because they said that they were managing things? That didn't happen. It didn't happen because they had emergency powers just like we have now, we still have now, and we're not accomplishing the things that we're talking about. At least this administration isn't. It just baffles me that we had an administration that's been more funded than any other administration in history. They've had more power than any other administration in history. They still have this power. And we did not resolve these issues. Pandemics are not excuses for us not to get the job done. Your congressional office had to manage a pandemic too. And not only did we deliver on pandemic resources, we delivered on EITC. We delivered on Medicaid. We delivered on COFA Medicaid. We delivered on all these other federal issues that weren't just pandemic related, because the work doesn't stop. So if you have emergency powers and you have funding to get these things done, there's no reason why you're not getting them done. And by all means, how do you explain to the people of Guam, how are you going to do it 4 years from now when those emergency powers go away and those federal dollars are gone?
Thank you. The 1 minute rebuttal will begin now.
We've had 3.5 years. He's at 10 years in the last in continuous elected service. We said that we would stabilize government finances, and we did. And we paid off this $83 million Government of Guam general fund deficit so we can get into a position so we can reconsider some tax policy. When you hear the other side, they talk about doom and gloom, yet when you talk with the Department of Defense, you'll see that military construction spending is going to be at a rate of $1.5 billion leading into 2029. We're going to have adequate financial resources finally because we were able to pay off this general fund deficit. And at that point, we certainly can make sure that we reconsider tax policy, but also make sure we expand investments in healthcare. One of the things that we'd like to do, and we are doing, is expanding and stabilizing funding. Medicaid is being paid 30 days now into the providers. These are things that have never done before, and we have the credibility to deliver.
Thank you. The 30-second response will begin now.
The deficit got paid off because we were able to bring the resources in federally. Folks, we have not had an economy for 3.5 years. You know, what has the government been doing this last 3.5 years when we were dealing with the pandemic? Everything was shut down. You had emergency powers to mobilize everybody. I mean, literally, it took away people's freedoms with those emergency powers. So what were you doing with all of that, with all of those resources to actually deliver on these things? You know, those are serious questions, and I know it sounds a little combative. But in the end, we're going to have to decide what administration is going to be running this item for the next 4 years. And if they had all this money and all this power, and they're still talking, how are we going to get it done 4 years from now?
Thank you, Congressman. For the next two questions, these are the final two questions. In recognition of the complexity of these issues, we're going to extend the rebuttal to 2 minutes. So it will be a 2-minute answer for the question and a 2-minute rebuttal. And we will begin with the incumbent team. So this question is in regards to Bill 317-36. Where do you stand regarding Bill 317-36, which would create a publicly searchable physician profile that would include any and all complaints, including unsubstantiated accusations brought against the physicians of Guam? Is this a bill that you would support or veto?
This is a dangerous bill. I will never support this bill. This bill is a vigilante bill. This bill puts out $10,000 reward for tattletelling on someone who has had an abortion or someone who did an abortion. I think that's very irresponsible. That's the bill, right? The arbitration.
May I refer to my physician
Is it
panel?
the arbitration bill?
Bill 31736 is the bill regarding publishing the unsubstantiated claims of physician complaints.
Oh, okay.
Yeah.
It's not the arbitration bill.
No, it's not. Yeah.
Well, I think it's still very dangerous. And I think it's still not very responsible, because this bill, to publish accusations, even if it's not being justified, is, I think, total reckless performance. I don't support this. Yes, there are claims that occur. Yes, there are errors that are made, but without giving due process to our doctors, even our nurses, I don't think that's right. So I don't support this bill. I think what we need to do is work towards supporting our doctors so that they can practice in a much more safe and conducive environment with equipment and diagnostic equipment that would help them better make their diagnosis. I think we need to look at how we can support our doctors and our nurses so they don't make those errors. We also have to make sure that our patients can feel that they can also have a place for appeal or for discussing these claims that they make. I think we also have to make sure that we are able to create a communicative environment and to better improve the bedside communication with our patients, and to also better relate to our patients so that the doctor and the patient know each other and they tell each other about information, and so that that can prevent any kind of claims going forward. So no, I don't support this 317. I don't think it's right, and I think it's dangerous and irresponsible.
Thank you, Governor. Your 2-minute rebuttal will begin now, Congressman.
Thank you. I have some experience with unsubstantiated claims. I know how damaging they can be. I know how they can hurt families. I know how there are people in this room who can take unsubstantiated claims and use it to hurt families. I know that there are people in this room who've sanctioned those kind of things to be happening. So I can absolutely empathize that unsubstantiated claims have no business being put out there in ways that are going to be harmful to you or to your families. No business.
If there are no additional remarks, there will be a 30-second response.
I talked about unsubstantiated claims. What the congressman is talking about is the ethics report. And if you read the ethics report, the report says that they have found substantive evidence. And so I am talking about unsubstantiated claims, not substantiated evidence.
Thank you, Governor. We'll move on to the final question of, oh, I'm sorry, there's an additional response. Sorry. And this question will be directed towards the Mrs. Salas-Metanani and Congressman team in regards to healthcare coverage. And again, this will have a 2-minute response and a 2-minute rebuttal and a 30-second response as well. So the question is, what are your thoughts on universal healthcare? Your 2 minutes will begin now.
I think healthcare for everybody is something that we absolutely should pursue in this community. I think that I'm a believer that healthcare should be a right. I think that Bree would agree with me. I think that the unavailability of healthcare for our community and for those who are uninsured is just so challenging. That's why it was so rewarding to be able to just get the Medicaid solution and get the COFA Medicaid solution, because we're filling the gaps. We're filling the gaps in those communities that otherwise wouldn't be able to get the healthcare that they need. I mean, that's why Bree was passionate about doing the job faster in terms of processing our COFA migrants. Yeah, we processed 4,000. There's still 10,000 out there. You know, mobilize the government workforce. Use those emergency powers to get the people out there into the streets to sign these people up, and let's get them their Medicaid. You know, even the doctors are coming to us saying we still have patients walking in and they don't have the Medicaid that they're actually able to avail of. These are all things that can be implemented, and the power to implement it is already there. The funds are already there. You know, this isn't something that we should be talking about as a policy. This is something we should be executing as a government. Universal health care is definitely an avenue to take. There's going to be a pathway to do that, and it's not going to happen overnight. But it's one of the many principles that we believe is something that we should embrace in this community. Everybody having access to health care. Nobody having to put something off because they don't have insurance. I mean, the doctors even communicated to us that some patients would come in too sick to be able to treat them with what would have been more effective and less invasive treatments and procedures. And that really has to stop in our community. That's not what Guam is.
That concludes the answer. We'll move to the 2-minute rebuttal.
Absolutely. You know, in this pandemic, yes, it's a public health emergency. It's an emergency worldwide. And emergency powers are there to do just that, treat the situation urgently. And as a result of the emergency powers, I was able to make decisive actions. I was able to make quick actions. I was able to bring quick resources. I was able to push out $2.2 billion in financial aid as a result of our emergency power. So there is value in that emergency power. And look at where we are today. As a result of that, we are turning a corner from the pandemic. We are now vaccinated, we are protected, and we are opening normally. Businesses are returning, schools are opening. On the issue of universal health insurance or health coverage, I totally agree with that. I think every person has the right to accessible, affordable, and available healthcare services. Our administration made that as a priority, and we pushed out and invested in our hospitals. We invested in our doctors. We invested in our clinics to make that happen. So yes, we can do more, and we are doing more. Healthcare is a very complicated industry. It's a very complicated system of delivery. And being in healthcare for more than 30 years gives me, I think, the confidence to address our health disparities. So please be assured that this administration invests in our people, and yes, universal healthcare coverage is a right.
Thank you, Governor. The 30-second response will begin now.
I believe we see eye to eye on this issue. I think that, I guess our difference is in execution. Bree and I are executors, you know. What we've done for you congressionally, what Bree's done for you over her last 25 years, bringing the news to you, we're executors. These things need to be executed, not just talked about. Let's get these things done, you know. And my goodness, if you can give us emergency powers to do it, I promise you we will. But without that, we'll still be able to work with everybody and with the legislature. I just wanted to give a shout out to them because they've just been phenomenal partners throughout our congressional service.
Thank you, Congressman. That concludes this final segment. We will now move to a closing remarks from each of the 4 candidates. They'll have 2 minutes to deliver their closing remarks. Each has 2 minutes. Or
yeah. There is no rule on this last closing remark. You have 2 minutes each if you want, or you can spend total 4 minutes, but you know, try to keep it to the point.
yes, sir.
You got it.
Oh my gosh.
Yes.
We are very generous.
Yes. So this last segment began with the incumbent team. So we will just go ahead and defer this closing remarks to the decision to the Congressman and Ms. Salas Matanani, if they would like to punt or receive. Okay.
We will punt.
Okay. All right, Lieutenant Governor, your 2 minutes, or 4 minutes total will begin now.
Thank you very much, and thank you for giving us this opportunity to speak about healthcare. As Lieutenant Governor, the governor has sought my partnership in addressing some of the most complicated healthcare issues and also some great opportunities in healthcare. And some of the things that I've done with her is pursue and continue to follow on the expansion of Medicaid. In a trip I recently took in Washington, I spent time with leaders on the House and Senate Republican side, making sure that they understand that the national defense of our country, dependent on Guam, means that healthcare should be stabilized not only for Guam, but for the entire region. I've had an opportunity to work with the governor to focus on veterans health services at the highest levels, taking advantage of an opportunity with geopolitics to provide opportunities and pathways for a big U.S. Department of Veterans Affairs healthcare investment on Guam. This is going to include processing on Guam, and it's also going to provide opportunities for COFA residents who are U.S. veterans to get healthcare here on Guam. And building a veterans clinic is going to be the pinnacle of that. This kind of investment is going to facilitate and provide expanded healthcare coverage for our veterans. The last 2.5 years have been difficult, but I have to say that the partnership and the work of everybody in this room and the Medical Association has meant that we've been able to manage the pandemic despite our isolation from the rest of the world. And over the last 3.5 years, we've had the privilege to lead our government into paying off a decades and decades and decades long general fund deficit. We were able to restore credibility with our federal partners and eliminate 3 federal receiverships. Those are the kinds of results that you can continue to depend on when you vote for us. And I ask you to please vote for Lou Leon Guerrero and Josh Tenorio. You can start voting already at the Westin and get everybody out there registered. Please vote for us, and we will continue to do the people's work and focus on improving the quality of our lives. Thank you very much.
I want to thank the hard work of our medical community. Thank you so much for being there to fight and to help with the COVID containment. I can't help but feel the excitement of our people and the hope that our people feel out there. Tonight, we presented you with our hard work, our accomplishments, and our achievements to address health disparities. We shared with you our visions on improving our healthcare delivery services, our plans to increase healthcare professionals and resources. We presented our progress in building a medical complex center to include a new hospital, public health, veterans clinic, and behavioral health. You see around you that our economy is recovering. You see around you that we are returning to some normalcy. Our businesses are open, our schools are open, and our tourism is returning. Yes, it is election time, and we are asking for your support to give us 4 more years. We are in this race without a cloud over our heads. We are in this race without having to answer questions about our integrity. We are in this race fully engaged with you. As you go to cast your vote, ask yourself this question. Do you want a leader that gives you hope or hopelessness? Do you want a leader that's experienced or just learning? Do you want a leader that is responsible or reckless? I ask you at the end of the day to say, who do you trust to move our island forward? I say, Lou and Josh, we ask you for your vote.
Thank you, Governor. You will now have the remarks from Congressman San Nicolas and Mrs. Salas Manzanano.
Hafa day, everybody. I'm, like I said at the Kandit debate, I am not a politician, and it was clear from the answers I gave tonight. But I want to thank all of the organizers for tonight's debate, and I'm glad that it's in front of a room full of medical professionals. And tonight I'm not speaking, again, like a politician. I'm speaking like the people that are watching at home. Because I'm sick, I'm sick because when my father wanted to come back to Guam, he couldn't because we don't have the specialists that he would need for his medical care. He died in December, and I buried him last month. That is why I was off island. I'm sick because my mother is in the same position. She wants to come home and live here, but she can't. I'm sick that when we go out to visit people at their homes, they're scared to go to the hospital or clinic for a checkup because they cannot afford to. I'm sick because for years we've been hearing about a shortage of nurses and doctors, and even as I speak, we're still short nurses and doctors. That is the reality. I'm sick because I read an OPA report that found that from all of the federal grants that we received in fiscal year 2021, there was almost $42 million in questioned costs. I'm sick because I'm here speaking before you when I'd really rather be listening to you, our medical professionals. You are the experts on healthcare. Our opponents will say, well, if you're sick, stay home. If that was the case, then everyone should, even all of you in this room, because we are all sick of these promises from politicians that never deliver. Thank you.
Thank you, Mrs. Salas-Matanani. Congressman, you have your 2 minutes.
Thank you very much. Bree is a warrior. Bree is quite the warrior. You know, there's a difference. There's a difference between hopelessness and discussing the realities our people are facing. Discussing them with passion, discussing them pragmatically, discussing them with experts, discussing them with the public. Adopting a philosophy of hope because we want 4 more years is the same politics we've been having, guys. It's the same politics we've been having. And that's why we're still debating these same issues. It's not hopelessness to talk about what the people are experiencing. It's not hopelessness to talk about the struggles of our community. It's not hopelessness to talk about what we need to plan and prepare for and the realities that are associated with that. Those kind of real conversations from real people, those are the kind of things that give me hope. And having those kind of conversations with all of you over these last several months and everyone else who we're going to talk to in the weeks ahead. Because when we discuss the challenges and when we discuss the ways we can address them, and we discuss the solutions that we can all work together for, that's where the hope comes from. So let us never characterize the struggles of our people as just embracing hopelessness, because that is turning a blind eye and a deaf ear to the people that you have been entrusted to serve. I'll never forget during the whole pandemic, the long nights staying up and answering messages and literally getting just a couple hours sleep. You know, I'll lose sleep for you any day. And so will this lady. But that's where the change really begins, and that's what we're going to bring for you. Thank you.
Thank you, Congressman. That will conclude the debate. I will have the president of the Guam Medical Association, Dr. Shea, come back up for the closing remarks for the association. But thank you to all the candidates for the absolute honor, and thank you to the association.
Good job, guys. Yeah, I want to thank both candidates, Governor Liu and Josh, and also the Congressman Mike and Bree. I think it's always challenging to come to a healthcare debate. The questions are not easy. You know, we'll critique the questions a little bit more in the next debate, but I think both sides did a very good job, and I want to thank both of them for coming on a busy schedule. And thank you for the audience for behaving. Oh my goodness. All right, thank you very much. And
That concludes this debate. We're going to riff about this and talk about this for, I'm pretty sure, quite some time. Pretty sure we all have something to say. But first, I want to say good job to my nephew, Kai Akimoto, as the moderator of tonight's event. I'm sure that was not an easy thing for him to do. First time he's ever done something like that. And he did a great job. And thank you to the Guam Medical Association. When we come back from this commercial break, we'll tell you about what we all think about the debate overall. And that final round was exciting for sure. When we come back. Yep.
4 years ago, we pledged to make healthcare more accessible, raise nurses' pay, and invest in our healthcare system. We have kept that pledge.
We increased income limits so that more families qualify for Medicaid, and we've made important advancements in telemedicine.
Our community health centers responded to COVID-19 while continuing to provide critical services.
The dedicated teams at our local and private hospitals provided quality, compassionate health care, even in the toughest situations, all while maintaining the highest standards.
Our healthcare partners, like our clinics, have also stepped up to answer the challenges, and we cannot thank them enough.
But if we are to provide the best in health services, we must build a new hospital.
Let's continue to move forward. We are all in this together, and we humbly ask for your vote. This is Governor Leon Guerrero, and I approve this message.
Funerals actually take a lot more planning than I expected. With us using island cuisine for the first time, of course we were iffy, but once they came and showed us their service, their food, tasted their food and everything, we definitely use them again because their service and food is just awesome.
Listen, Congressman Michael Siniclis showed up for that last segment of the debate, and I'm wondering, he definitely won that last round. Now, what I'm wondering is, there's a lot of debating.
Well, now they're making noise.
What I'm wondering, and you guys we can talk about this. Maybe we'll disagree. Is did he bring that zeal that he's known for too late in the debate? Should he have, come back with that fighting spirit in the first round? And he said it in the last round, and it really did look like the governor was rattled by it when he started off saying, I'm tired of being nice, and then he just went for the jugular. He definitely won that last round. Josh Tenorio won that second round. The first round was boring. I thought it was pretty much a toss-up. But was that enough for him to have won the debate? Did people even stick around to watch the entire thing to see that performance? Let's start with you guys.
I think I'm with you. It took a little bit of what he said about Sabrina getting her yang up and showing a little bit of her agate side, and I think that inspired him. But a little bit late in the game, I would have liked to have seen. And it's not like going to a racetrack to watch the accidents, right? But I would have liked to have seen him, and the opportunities were there for him to underline and underscore some of the accomplishments that he was bringing from Congress, and be able to expose what I think were gaps in the coverage by the Leon Guerrero Tenorio administration. I don't not with you on that.
Which he did not do in the first round. He
said,
missed that opportunity.
They were right there in front of him. I kept waiting for him to at least take that swipe.
I'm sure Ginger disagrees with us.
If you're talking a swipe, the one thing that stood out to me from the whole thing was the substantiated allegation. I thought that was the most serious part of the governor's attack. I think she was trying to be more focused on the answers to the questions. I think, she was both camps were really trying to answer the questions. I can't say a lot about the questions because they seem to be very repetitive. I wish there would have been more of a variety of things that they would have.
And both camps made that point about the repetitive questions.
They were obsessed about retention.
They were. And something that people have to think about is, Mike St. Nicholas was in the legislature for years, you know what I mean, and nothing was done back then. I mean, it's disingenuous to say that you can wave a wand and all of a sudden magically there is a solution. So I think that the Lou and Josh team took it very seriously, and we're discussing the actual real challenge that they have, like right at this moment, trying to do something which everybody on the island knows is difficult. It's not that they don't want to do it; it's very difficult. And I think that the Mike and Bree got a pass because they're like, well, it should be done. But I thought that it was really interesting how the governor said, no, you shouldn't, be able to put an unsubstantiated charge against a doctor. Absolutely, that's the wrong thing to do. And then Mike was like, well, I know about unsubstantiated charges. And she's like, that's substantiated. That was 2 years investigated, referred to the Department of Justice, lawyers, an entire process, and a 217-page report, which is online, which has evidence and documentation. I mean, this isn't like somebody throwing a rumor. This isn't like the Kandit response blog. This is like a 217-page report done by lawyers and ethical experts.
Which is being defended by lawyers.
And 10 members of Congress, Republican and Democrat, who reviewed this and did it. So, I mean, I thought that was a jugular hit by the governor. Okay. And then the other thing that got me was, I mean, really? So you're going to both of them are going to be in pain and crying. Okay, that's not a solution. That's not a vision. That's not an answer. I didn't hear one thing the entire debate about a concrete measure that they were going to do to execute to be able to address a very serious challenge which has faced every single governor since 1970, since we have elected governors. There's a lot of challenges on Guam. And instead of hearing very specific things that they were going to do, we got them to the point where she was literally almost in tears because she was really sad about something. Well, that's great that she's sad. And I mean, empathy works. I get that. And the idea that empathy will win you an election, that's the question. Is it enough to say, I feel your pain and almost break up? Okay, so we're going to vote for you because you feel my pain. That's one answer. Yeah, there's some people that go for that. Or is the answer, I'm going to pick people who are struggling with all of the challenges day by day. They're going to be very specific. They're going to be boring even. They're going to tell you what the numbers are, who they're talking to, what they're trying to do. And then Bree and Mike are hitting the government employees because they're basically saying that nobody's doing anything. Like government's not behaving she's saying government's not doing it fast enough. That's not a hit on Lou and Josh. That's a hit on the 12,000 government employees that have been out there trying to get that done. That's a hit on all the clinics that are working overtime trying to get that done. So you've also got to think about all the people in the healthcare industry who have to deal with this and face it every single day. That's an indictment of them. So, I mean, if their approach is empathy, then where's the empathy for all the people that are part of the system that work every day, that process those? I mean, the amount of work that was done by the government to process unemployment, to process the larger number of COFA applications, there is a lot of work that's going on. And recognizing that and dealing with the reality, or just saying that, it's really sad and we empathize with it and that's the reason you need to vote with us because we feel your pain. Is it enough that if they feel our pain? I mean, is feeling my pain going to produce a solution in the next 4 years that is going to make this island better? And I think that's a really tough question. And I think when people look at that, it was really clear from the two teams what the difference was.
Doc, is Bill Clinton's "I Feel Your Pain" going to resonate in the primary election after that performance by Congressman St. Nicholas at the end?
Well, just a couple of things. I do agree that I think the best exchange of the night, and I give this debate a split decision. Okay. I think that both sides scored points with various groups that they wanted to score points with. That's the first thing. But I think the best exchange between the primary candidates, that is the governor candidates, was between Governor Lou responding to Mike about there's substantiated and unsubstantiated. I thought that was a very interesting set of points there. On the other hand, at the very, very end, Bree using her narrative approach was extremely powerful. She was able to make it real for people, that healthcare is a real thing. It's not an abstract thing. And she made it personal. She gave a narrative to it. And I think that's a very powerful technique to use in summative debate techniques. And so I think she did a really great job. And so that's where I think her KUM experience really kicked in. because she was able to explain it in that sort of way. And so I think that and by the way, I do love Kandit blog, so I should say that also. That's the,
Thanks.
But I do argue with it all the time too. So I'm not a total fan, but I do like it. I do like a good debate. Thank you.
So what's next?
In terms of what? Well, early voting is going on.
Well, the early voting is going on. I'm wondering if there are people that voted today that watch the debate and go, oh, man, I want to get my ballot back. I think I might have changed my mind here as a result of what we saw. Do we think that any of what we saw tonight is moving the needle in either direction for either of the campaigns?
I think if people watched up to the third and final segment, the needle moved in the direction of Mike Nicholas. If they didn't, the needle may have moved in the direction of Lou and Josh.
Yeah, it all depends on which part of the show that you managed to be watching. Well, we'll see what happens. They had alluded to looking over the questions, and we weren't very, very satisfied with the nature of the questions. They seem to kind of meander through trying to explain why we're asking you this question, and then we're going to ask you the question.
But, Ray, there's a key point, and I hope that they'll catch on to this in the future. It doesn't matter what the questions say. It matters what their answers are.
You know, that's when we were prepping Eddie Calvo for both 2010 and 2014, we always told him, like, when you hear the question, just toss it out of your mind. You know, group it into a topic and talk about everything great that you did working together with everybody everywhere, and then everything that you want to do because your vision is so extraordinary. And he freaking nailed it. That's some great advice for debates. Is never mind what the question is.
So stop trying to answer the question. Acknowledge that you were asked the question.
Yeah.
Oh yeah. Recruiting and retraining and neonatology, very, very important thing. But have we talked about the state of labor and delivery at Guam Memorial Hospital? Tom Shea's in the audience. Tom's been asking for 10 years.
I beg to differ. So Guam is a really small community. So in the States, that might work. You know, when you're electing people that you don't know, all you're going to get is you're going to get the debate. You're going to get, snippets. You're going to get commercials, and you kind of have to judge on that.
Well, I don't know. Eddie won twice.
Who in the States actually gets to meet their candidate, right? On Guam, you have a very different issue. On Guam, 50% or more of the island has had an opportunity somewhere to be in the same room with and has an opportunity. And anybody who wants to show up to a meeting can actually meet the candidates. And I think that one of the things you're going to see, something important that you've both said is the grassroots is really energized. And if you look at the Lou and Josh campaign right now, one of the things that wins elections is the grassroots campaign. And what
can we go back to, yes, let's talk about that.
Is people coming out, people mobilizing, people gathering and discussing and talking and understanding who are these people that we're going to elect to be in charge of our island for the next 4 years. So in Guam, it's not an abstract. It's not like, oh, I'm going to empathize with you, throw out a commercial, say I feel your pain. People know who these folks are. And their opportunity to sit there and talk to them, to go to meetings, to really see what their soul is like. What is their history? What is the history of these people? What have they done for this island? And when you look at people like Lou and Josh, I will say this much. Lulian Guerrero is not a slick public speaker, okay? That's just a fact. And Mike Nicholas is a very slick public speaker, okay? He can put a turn of phrase that is just,
that's what we got. Josh is the lieutenant governor with the golden voice.
But Mike Nicholas
can say that dynamic between Mike Nicholas and Josh Tenorio?
No. There was an exchange.
At a certain point, that was the debate was between them.
But my point is, when you look at Josh, he's not only good at being able to make public speaking. If you look at your own blog, people love him.
He's a very likable person.
Because people know him, and people know Lou. She's been a nurse on this island for how many years? She's been at the Bank of Guam, working with people who want mortgages, who need to have their lives, supported by a bank. So we know who the candidates are. Now, we know who Sabrina is. She's been a reporter. And she's been, at KOAM for 25 years, okay? So people know that. They see her on TV. They haven't actually engaged with her. So I thought this was an opportunity to get beyond the news reporter and to really see, was there substance there? Is there intelligence there? Is there policy there? Is there experience? Because running an island is not reporting about it. It's running an island. And people need to see that. And that's what these debates do, is it brings you in to see who the person is and do they deserve that position of public trust.
You've made the point. I'll make this point, not necessarily in defense of Sabrina, but in defense of a profession. And she has been doing, as you point out, for 25 years. You know how competitive the industry is. You know how difficult it is to run a newsroom and a news department and do it so that they can make some kind of money, some decent revenue as they do this. To be able to say that I've done anything for any longer than about 10 or 15 years on Guam, I think is some kind of an accomplishment. So I think she is accomplished. She might not be as accomplished and polished as a politician or a deliverer of a debate that maybe others would like to have seen, but I appreciate the fact that she's up there. I appreciate the fact that Mike was finally able to find somebody to run with him.
Yeah, well, yeah, that's a whole other issue, okay?
After
going through,
what
was it, 4
about
other potentials, he finally landed on her. So, I mean, that,
Well, I mean, he never bothered calling me. I don't know. I mean, a guy could have reached out to me a little bit earlier. But after he got Bree, I said,
that
that's
says
okay.
something, doesn't
That'll
it?
do.
Doc, what's your assessment on this whole? So, in that third round, Mike St. Nicholas, he came to his running mate's defense and he said, you know what, she's not polished, and that's because she's real. We're real. Is there anything to that?
Oh, absolutely.
Okay.
There's a whole tradition in politics going back. You can come up with easy examples. Abraham Lincoln, the rail splitting, tobacco chewing guy from, the self-taught, whatever, So there's a strong tradition in politics for the connection to the common. And the advantage that Bree has had, and this is overlooked in Ginger, you have the same advantage. Because you're on TV for so long, people feel they know you. Like they feel they really know you. And that's what happens with folks a lot. And that's the advantage that Bree brings to Mike's ticket is people, regardless of what dispersions, when people make dispersions about her experience on TV, people take it personally because they feel they know her. So you have to be really careful. The other thing is it's very hard to run against female candidates in elections. And so what happens is when people criticize female candidates, just on basic points alone, people will sometimes change their opinion. So you got to be really, really, really careful.
Is that why Mike St. Nicholas was hesitant to attack the governor's record? Because we saw that in the first round. He was hesitant to really say anything.
You have to be very, very, very careful. And you go back to the Ann Richardson, George W. Bush
Texas governor
race. Yeah, absolutely. You can get eaten alive in a heartbeat running against female candidates.
Well, maybe that's why it felt, I think, maybe more comfortable for me and more comfortable for the audience when Mike seemed to be engaging Josh and Josh engaging Mike. It was easier for me to understand that, from the Warrior perspective, as opposed to, when Mike even apologized for sounding combative. And I thought, well, that's kind of an interesting. I'll preface this with an apology.
It would be neat in future debates if the male candidates could debate each other and then the female candidates debate each other, to be blunt.
What, Ginger? Why did the lieutenant governor elect to begin debating the congressman about those issues? Is he the attack dog, or what's going on there?
I mean, when it comes to the team, I think Lou and Josh sort of have this seamless team, and I think you can see that in the way that they both sort of understand the issues in the same way, because they spent 8 months working with each other before they ran, and they've now been working together for 4 years. It's a pretty seamless team. Everybody knows that. I mean, you go around to meetings and they share constantly, and they have a really good flow between them. In the case of Mike and Bree, I mean, that's, how many weeks old at this point? I mean, it was never something that was really put together. So, you're seeing the differences in approach. You're seeing the differences in opinion. They're being nice to each other because they've now decided to run together. But you're not seeing sort of this seamless team being presented because, they're still working it out.
New.
It's still being worked out.
You remind me now of a thought that's in my head, and that is that Josh Tenorio, I think we are getting the hell of a bang for our Lieutenant Governor Buck with Josh Tenorio. He's doing a lot more than just Island Beautification Task Force. He seems to have taken on a lot of responsibilities in this administration I don't know that any governor has allowed their lieutenant governor to take on. So I think, and just in your last debate with him, and even tonight's debate, it occurs to me while I'm listening to him that he is, and I use the phrase, deep in the weeds on all of these issues. He is definitely involved in the day-to-day operation of the government of Guam.
Absolutely, even in healthcare. But let me circle back to something that Dr. McNinch said, because I mean, I think it's interesting.
I'll be back. I just need to pee. Okay.
When they're talking about when you were talking about the approachability and the fact that people know somebody. It's one thing to know somebody, but I think people on Guam are very smart. They also know what someone's capabilities are. Not all media people are equal. I mean, we all know. I mean, there's a reason that Ray has lasting power.
I outlived everybody.
It's more than that.
Oh.
It's because the quality of the work that you do in media is clear, and people see that, and people know that. When you say the name Patty Arroyo, it's royalty because of the quality of the thoughtfulness and the fairness and the analysis that she puts into the work that she does. So just simply because somebody has been on TV for 25 years doesn't mean that people necessarily respect the policy chops that the person has or the capability that the person has to go beyond. This is what I'm talking about, Peter Principle, to go beyond that job, to do something that is going to be 100 times more demanding, that's going to require much more experience. So in all the years that I was doing media, I mean, I have a master's degree in public policy, right? I'm not a media person per se.
Right.
My background is in government and public policy. So yes, I was doing media, but people, I think, related to that. And when you listen to Patty, I mean, her analysis and her ability to really navigate some of the most complex issues. I mean, if you would have put Patty on the stage and asked her these questions, she would have slayed it because she would know those issues.
Boy, Ron, are you getting to feel like this might be like a journalist girl thing going on here? I mean,
maybe I'd like to see Ginger and Bree debate. You know, how about that? That's right.
Exactly.
That's
That's kind of the sense that I'm getting here in the conversation. I get it that there with newsroom rivalries and things like that might have. Oh, good, you're smiling. That means it was a fair response that I've got. But like I said, I'm trying not to defend her too much from a perspective of somebody that was a colleague of mine. And we chewed on some of the same stories when I was at Hit Radio and she was doing news still for Guam Cable TV in those last waning days of the Lee Holmes empire. But again, there is a staying power. There is, a kind of thing. And even me as a commentator, I have journalist chops. I choose not to use them because I have more fun doing what I do, and I think it's more relevant to the people that are listening. It's the only reason why I think anybody listens is because I think they believe that I sit on the same side of the table as they do. At least I hope it does in some kind of analysis.
I know personally
all of us,
all four, and I know you guys pretty well too. And Ginger, I don't know you as well as I used to because you're
we were on the cover of TV Guam.
Yeah.
Once upon a time.
Yeah.
It was still one of my favorite pictures of us, yeah. The
all
little kid
four
pictures.
Of the candidates, I know all of them, and I've got to tell you, I have respect and admiration for all four of them. I think all four of them are bright. I think all four of them have their heart for Guam, and I think that's the commonality. And anybody who wants to run for governor has to be willing to put their name and put their face and put their soul out to the public, and that's not easy. And they have my world of respect for doing that. Now, I got to say, on the other hand, I don't always agree with everything all of them have ever done, and that's normal too. But I think that in general, there was a great debate tonight, and I certainly enjoyed being on the panel with you all tonight.
Well, the ridiculous thing is I guarantee in 4 years, GMA is going to have another debate. They will have another debate, and I don't know who's going to be in it.
And I hope they do better questions. Now, but let me just clean that up.
We could recycle them. You and I started talking about how when you were in the media, when you were on the job and in front of the camera and doing the anchoring and interviewing and being at debates, these are still some of the same questions, and it's been a long time since those years.
Yeah, no, that's
we're
true.
asking the same questions. We keep chewing on the same ground. At which point are we going to become the mature island that we are and really grasp these problems and solve them? I made a point a while ago about the swimming pool. My God, if we can't figure out how to work swimming pools and keep bathrooms clean, maybe we don't have a whole lot of business talking about building hospitals and putting together, a 21st century, 22nd century healthcare system.
I got a question for Dr. McNinch. Sorry.
Sure.
I didn't mean to just take this over.
Well, I thought you were coming back with beer. That's the only reason why I stayed.
Doc, did tonight's debate do anything to drive more interest in voting in the primary election?
Well, here's the scary thing, and Ray, I hope you'll talk this out a whole lot with the public, and,
You'll have to remind me.
Troy also. This early voting stuff bothers me because people could have changed their opinion tonight by
said.
listening to these things. And so that's what bothers me about early voting is suddenly it's like you get married and you're in Vegas and the next morning you wake up and say, oh my God, what happened? Because you've already committed your vote to somebody you may have changed your mind on. And so I encourage everyone, while early voting is an option,
If you need it.
if you need it. So wait as long as possible, because a lot of good information came out tonight that can really affect people and how they feel.
I'm thinking in my head about the Camacho Ada team that got a pass tonight. I don't even think. I think they weren't invited.
They got a pass at a lot of the different debates. I mean, the first debate that Kandit had, we
I
thought they were
get
going to
it.
show up, and
I
they didn't
understand.
show up. So, I mean, I don't know if they're afraid to show up or
No,
I mean,
they want the Democrats to duke it out. That's exactly what's going on.
which that is a strategy. But I mean, at the end of the day, I think that one of the things people need to keep in mind when they're looking at these debates is we need to get beyond the talking points, okay? Because one of the things that really bothered me about tonight's debate is Mike Nicholas just has all the talk. It's this smooth, slick presentation, but I'm like searching through it, trying to find where's the substance in it, where's the actual policy recommendation. How is this administration going to do something that works, right? I went online, I looked at their platform, right? Create another inspector general and build up the governor's office and add all these extra people to do all this stuff that the government's already doing. It sounds like more bureaucracy to me, right? And he has the benefit of not having a record in an administration yet, not having to deal with any of these from the executive branch. He's always been a politician. It seems odd to me. Bree's always hitting politicians. He's always been a politician. So what has he ever substantively done that we can judge as voters?
Well, I don't know. I can go back 4 years and take a look at the platform that Lou and Josh came out with. That's a lot of pillow talk and a lot of dreams that haven't come true. So, as far as campaign platforms and things like that, it always feels like it's some academic job for somebody to do, but just so that we've got a platform that nobody actually follows up on. That's my experience. And I'll be happy to share the platform with you so you can go through it like I did and say, okay, they talked about that. That hasn't happened. That hasn't happened. That dream didn't come true. Just saying.
Ginger, are you concerned that voters might start to think, or maybe already do think, you know what, I'm tired of hearing that, it was the pandemic excuse?
Okay, so there's two schools of thoughts on that. One is you just don't mention the pandemic, which is really not realistic. I think the fact that people have just kind of turned off their minds. I mean, did we forget that day when I was sitting in my place in Guam and somebody told me I couldn't get on an airplane and, basically for 4 months couldn't go anywhere, had to wear a mask, and you're literally worried about catching something which could kill you, okay? So now all of a sudden, people want that to just sort of go away. They just want to pretend it didn't happen, and they just want to kind of move on.
Well, we want our lives back.
And I think we're getting our lives back, and I think you're seeing economies all around the world restart. It's difficult. It was a lesson for the whole world. It wasn't just Guam. It was a lesson for the whole world. But I think recognizing that is being real. I think explaining that governing on Guam is difficult. It's easy to just say, we're just going to be able to do everything and it'll all be wonderful. We'll talk to you all and we're going to do everything and it's all going to be great. Every politician has said that since the beginning of time. And for politicians that have actually held that office for 4 years, and they're able to show concrete examples of what they've done. I mean, and they listed it today, eliminated the deficit. They're fixing parts of GMH. They've got the plans already and got the bill from the legislature, and they're working on a new hospital, which, by the way, we need a new hospital. I mean, this isn't like a abstract policy thing. I mean, when we get sick in 5 years from now, we need to have a hospital, right?
Well, but let's make sure that we take care of the hospital that we have. In the meantime, let's not let that continue to die on the vine until we figure out what color we're going to paint the new one.
And they've been fixing it. But see, this is the thing that gets me. So you've got hot air on one side, and then you've got people who've been doing the things that need to be done. And one thing I will say also about Lou and Josh is they're not braggarts. They're not like wasting all of their time. Oh, well, I did this, I did that. They're the kind of people, and people know that, who just buckle down and do it and don't waste all their time trying to get all the accolades for it.
I think everyone on YouTube and who's seen the Google ads would disagree.
Yeah. Is she going to pay for all these plugs that she's given Lou and Josh? I mean, what's the political rate for the last half hour
I
of
think
this?
all the ads we've been seeing. Derek Kanata is right here. You talk to us about all the political.
No, you briefed her well. Good job. Say auto spot 5 times.
But you know what? Every gubernatorial campaign has to do that. They got to come out. They got to talk about their accomplishments. Otherwise, how are you going to trust that they're going to do something? And so, talking about your accomplishments, that's a thing. But can you guys dial back?
I don't
on
know. No. Hey, private sector. I run. I play
I'm
those
talking
ads.
about the YouTube and the Facebook ads and all that stuff. It's just clogging up the feeds.
Well, it's, the thing that's important to really look at, we had the GMA debate. We know the doctors are really concerned about a lot of different things. And Guam's problems are not easy to solve. I mean, we've all been talking about the problems for how long? And it's about a slow, steady hand. It's about people that have realistic plans. Where do the revenues come from? What are the solutions? How do we surmount these things one thing at a time and make Guam a better place? And I think people are going to take the time to really say, who has Guam's best interest at heart? I think, all of you are going to say all 4 of the people up on that stage. You know what I mean? So for anybody to accuse the other one, that always gets me about politics sometimes too. You're making it sound like, Lou got into office to destroy the island. Of course not. The woman has done nothing her whole life but try and make things better. And everybody is doing their level best. And I'm just saying that it's not necessarily a fair comparison, because had we had a normal economy for the last 4 years, then absolutely, I would say judge them on what they'd been able to do.
I think there were missteps in dealing with COVID.
Went to zero, Ray. Tourism went to zero.
Tourism went to zero,
okay.
But there were still
During
people that were working here. There were still time. We didn't have to close down every business on Guam. We didn't have to tell people that they couldn't buy a pair of Dories at Kmart.
They couldn't even make tax refunds, okay? And yet this time the entire economy shut down because of a global pandemic, and the island kept on going. They made an unemployment program in 6 weeks.
Half of that program was already there because the software company that we were working with, Hire Guam, was already doing unemployment programs in the mainland. They did not build it from scratch. Hire Guam. I talked to Dave Del Solo about this just this week. Dave Del Solo talked to the guys over at Hire Guam, and those guys said that, you know what, we're doing the unemployment programs for these states here. They've already got it. All they had to do was massage a few of the modules in there and make them applicable to Guam. That was it. So I'm not saying it wasn't Herculean. It was, but a bunch of the steps that were taken, were made easier because the software company that we were working with already had the modules in place because they were already doing the work for anybody else. Dave said it on the radio.
I'll tell you. And the one thing I thought that they didn't take enough credit for was the time that they've spent working with the federal government. A couple of times, Josh mentioned it, a couple of times Lou mentioned it, where they're talking about the work that they've done with the federal government to increase the amount, not just now. This isn't like ARP funding. They're looking into the future. I thought when Josh talked about getting a veterans wing, that's something. How many veterans? 7,000 veterans on Guam, and we don't have veterans health care.
Peter Scrow and I were working on the creation of a new veterans hospital. In fact, I had one of the meetings of it right here in the Hilton Hotel a few years ago. It's not a new idea. That idea has been floated around for a long, long time. And
they're doing something about it.
Well, you keep having meetings. I think what did they say? They had a meeting?
No, it's more than meetings. But this is the whole issue, okay? So everybody can look back and everybody can judge, but I'm just saying that the fact that they're looking back and judging what has been happening in the administration shows that there's been activity in the administration. And this attack on, people are just politicians, well,
if we keep politicians around, it seems maybe we'll just have Bree run for governor because she's not a politician. I don't know. Are we debating whether we like politicians or not?
Politicians are necessary, but the thing that you have to think about when you're looking for a governor, it's not the legislature, it's not Congress. Governor is an executive position that has to be able to manage a $2 billion economy, right? All of the government employees, all of the elements of government. There's bonds, there's utilities, there's education, there's security. You have to have all of these pieces. And it's not just asking people questions because, okay, let's carry that out. What if you call everybody together, you ask them questions, they give you 3 ideas. Okay, that's the idea I'm going to go after. How can you judge if that is the good idea that's actually going to make the island move forward? If you don't know yourself, if you don't have some basis in public policy, to be able to guide that and to judge what would be good for the people and what wouldn't be good for the people. It's dangerous, because if your policy as a governor and lieutenant governor is, hi, we're just going to listen to everybody because we don't actually know what we're doing, we're just going to listen to you, and then we're going to do what you tell us. Well, I mean, do you agree with everybody that comes on your radio show when they have an idea? Oh, let's do this. I mean, if you just start to pick up whatever idea comes throwing at you and go after it, I mean, there's a real danger to an incredibly fragile island. Our economy is very fragile, and being able to get us back on track, being able to diversify the economy. I was shocked in the last debate. They asked Sabrina a question about diversification. She goes, I don't have an answer for diversification. Oh my God. If we don't diversify our economy, look what happened when it hit tourism. So, I mean, they've increased 39% increase in spending on agriculture so that we don't have to go spend $48 on a head of lettuce. And
I know, but
when is that going to happen?
Right?
But Ginger, where are we today? Honestly,
Are you better off today than you were 4 years ago?
And that's a very simple question that people would give you a very simple answer. It'd be no. And then you go back to the whole thing about how much of the pandemic can we use as an excuse.
How long could we use that?
I mean, we can talk about accomplishments and doing all these wonky things throughout the term, but what difference did it make? And in these big ticket issues like taxes, like the legislature wanting to, or some members of the legislature wanting to, but the governor saying, you know what, I want the 5% forever, and how that has hurt the economy. When you talk about
it, hasn't hurt the economy, and as a matter of fact, 90% of the businesses are using a 3% tax.
It ain't Payless. I don't buy my stuff from them.
Because
Not
this
Home Depot.
administration reduced taxes on 90% of the businesses. And I'll tell you what happens. When you reduce that 5% GRT, right? Where's all the money going to come from in the next 10 years or the next 8 years? Federal funds that are coming in and military expansion.
Sure.
If you reduce the business privilege tax, you're not going to be able to take that money and invest it in people's needs on the island. And the idea of cutting taxes at a time when we need more services, I mean, it sounds beautiful. It sounds beautiful.
The taxes have gone up by themselves. We're talking about the delta.
When we don't have the tax revenue,
the tax revenues
no
that we are enjoying right
people.
now. Well, then we've got to prioritize what services the government of Guam does. We're going to have to actually do what families have had to do for the last 2 years, is figure out what we can do with and what we can do without.
Difficult decisions that have to be made.
12,000 employees might need to be 10,000 employees.
Worst thing you could do.
I disagree.
Setting aside, the federal funds that came from the pandemic and all that stuff, aside from the increase in the BPT, which created a tremendous amount of revenue in the government of Guam, there was also the tremendous amount of revenue created when Joe Biden and the new Congress increased corporate income taxes, and we're not talking about that. The entire reason the BPT was increased was to battle the Trump tax cuts, which were reversed by President Biden. And the government of Guam has been awash in cash. And the congressman made a pretty good point. There's never been this much money that an administration has had to just play around with an extraordinary amount of power.
But I don't think the word, playing around with it. You make it sound like they weren't playing with it. They've given it to people. I mean, did everybody just pay attention to the news yesterday? We all just got $100 credit for the next 5 months on our power.
No, we didn't. Ratepayers got
it.
Not taxpayers. That should have come back to as a rebate, like Joe at a time, to every single person that filed a tax return in 2022.
Okay, you're splitting hairs. We're all going to get the benefit of that.
No, I'm not.
Okay?
But wait a second. Who's the power bill under your name on? The power bill, all of a sudden it gets shared by everybody. Only utility ratepayers are going to get that rebate. I think that the incredible amount of money that has come back to the government of Guam because of inflation, we'll call it Putin inflation if you want to, or Biden inflation or whatever, I think that's where the significant amount of money is coming into the government of Guam. We have overpaid. The consumers here have overpaid their taxes, retail taxes, etc., and that needs to be sent back to every single one of us in the form of some kind of a rebate. The thing with the utilities, I'm happy about that. Great. I'm gonna get a $500 credit for my power bill. Super happy about that. But what about the additional taxes that I have paid when I shop at places like Home Depot and Payless that are not enjoying this what is it, the reduction in taxes that you were touting?
So you're talking about taxes as if the businesses are going to just automatically reduce the costs, which is not the case. Part of the reason costs are going up is because you've got supply chain issues, you've got inflation issues. These are things totally not within the control. I mean, I went to King's the other day. They had to reprint the menu, and it was like 3 times as expensive. That's not this administration telling them, oh, we need your taxes, we're going to like double the prices on the menus. The reason that the menu price is doubling is because there is a war in Ukraine, there is a supply chain shortage, there is a crisis that is going on all across across the world. And as they always say, when the world, catches the cold, Guam's the one that sneezes, right? We're the ones that have to deal with that. But that whole reality is just sort of thrown out the window, and you're all just saying, oh, Lou and Josh are responsible for you having to pay more.
Say Lou
and
and
then
Josh.
everybody
I'm just
goes,
saying
oh,
that there was a
let's cry about
windfall.
it, throw them
There's a
out, and
windfall
elect
in the government of
someone
Guam,
else.
and that money should
It was
rightfully,
not
that
a
excess
windfall.
revenue that has not been
the excess has been
$100
applied.
million.
There's actually a big issue that we got to blame both teams for not addressing, and that's the shipping issue. And that there are things that are within
and Mike St. Nicholas could have done something about the Jones Act and reduced that, which has always been a tax on this island. I mean, so he wants to talk about their record.
Well,
the Jones
none
Act
of
has been
them-
a problem.
none
You
of
know,
them
we were
have
talking
been.
about it's
Hawaii
been a
hasn't been
problem
able
for
to
how
do
many
anything with the
years?
Jones Act.
So
Alaska's
why
not been able to do
try?
anything with it.
Why not try?
None of them
That's
have.
not an
None of them have
excuse.
said anything
Hasn't done
about this.
anything about the Jones Act.
None of them have
and
said anything about
that is
shipping.
one of the worst things on this island that causes our lettuce to be $48.
Yes.
No
is the
disagree.
Jones Act.
There's a.
Did he introduce one measure? Did he even try? Did he show up and go talk to the other members
But
on his financial
I'll tell you,
services
Ginger,
committee
we
to address
asked-
that?
we at
He
Kandit-
didn't do anything, and
We
he
at
got a
Kandit have
pass.
asked our governor and our senators, all of them, whether they would do something, whether they would file a friend of the court brief in litigation in the U.S. District Court of Washington, D.C. Actually, it's not just Mattson that is suing the U.S. Department of Transportation to kick out APL. Now it's APL that has filed a suit in the U.S. District Court of Washington, D.C. And then among the allegations are violations of the Sherman Antitrust Act. We asked our Attorney General, are you going to do anything about it? We asked our legislature, our governor, are you guys going to do anything about it? No one's responded. It's almost like this is just an issue that's too complicated for our leaders.
Well, we have been in court on the Jones Act. It wasn't that long ago. Joanna had gone after Mattson.
That was like a long time
It was an
ago.
awful long time ago, but it's still the same issues. Hey, you know what? At least one of us has to wake up at 4 tomorrow.
Yeah, Kandit's off tomorrow, by the way, guys. We're not going to. We
see
have
how
to
you are?
break
You
down here.
Keep me awake until 10 o'clock at night, and then you're not working tomorrow?
Yeah.
I'm
That's-
calling you anyway.
yeah. And I didn't even get you the beer. Thank you guys so much. This was so lively. I'm told that our audience stayed for this. Yeah. The debate's been
debate's
over for like
but I
30
wanna hear what
minutes.
these
We
Our
appreciate
audience
the
stayed.
audience.
Yeah.
No, thank you,
Thank you guys so much.
Pleasure to be a part of this. Ginger, it's always a pleasure seeing you. Fun. We've been debating like this going back to what, 1982, 1983. From I'll tell you, sorry. It's been a long time. Dr.
But man,
McNish,
Ginger, you look great.
Thank
You freaking look great.
You too.
I love you.
Oh, God.
Hey, thank you so much.
you
and-
look great too, Ron.
Oh, absolutely. Thank you. And let's go, Brandon. Thank you.
On behalf of the Kandit team, this is Ray Gibson saying good night, and tomorrow morning it'll be a good morning.
Not for me.
Ah.
Four years ago, we pledged to make healthcare more accessible, raise nurses' pay, and invest in our healthcare system. We have kept that pledge.
We increased income limits so that more families qualify for Medicaid, and we've made important advancements in telemedicine.
Our community health centers responded to COVID-19 while continuing to provide critical services.
The dedicated teams at our local and private hospitals provided quality, compassionate healthcare, even in the toughest situations, all while maintaining the highest standards.
Our healthcare partners, like our clinics, have also stepped up to answer the challenges, and we cannot thank them enough.
But if we are to provide the best in health services, we must build a new hospital.
Let's continue to move forward. We are all in this together, and we humbly ask for your vote. This is Governor Leon Guerrero, and I approve this message.
Funerals actually take a lot more planning than I expected. With us using island cuisine for the first time, of course we were iffy, but once they came and showed us their service, their food, tasted their food and everything, we definitely used them again because their service and food is just awesome.